7 common medications that can be harmful for your kidneys. We live in a time of medications. They help us somewhat, but they can also kill us silently. Now, as we age, our kidneys won't work as smoothly. It's important to keep them away from too many chemicals and medicines. But it's challenging because aging often brings a host of health issues and more pills to take. Certain medications can be nephrotoxic, meaning they can cause direct or indirect harm to the kidneys. As a result, the kidney's ability to filter blood diminishes and harmful waste builds up, leading to serious health issues. Kidney damage severity is measured in stages, ranging from mild dysfunction to complete failure. The risk of kidney damage from drugs or drug-induced nephrotoxicity increases as you age and have kidney conditions. There are 2 main types of kidney damage from medications: dose-dependent toxicity and idiosyncratic toxicity. Dose-dependent toxicity means that damage increases with higher doses. In contrast, idiosyncratic toxicity is unpredictable and varies greatly between people. Sometimes it's best to avoid these drugs altogether. Drug-induced nephrotoxicity can result from muscle tissue breakdown, or rhabdomyolysis, kidney tissue death, or renal infarction, and acid buildup, or renal tubular acidosis. This can result in decreased kidney function and other conditions like nephrotic syndrome or electrolyte imbalances. In this video, we'll explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Remember, understanding the risks associated with them can empower you to make informed decisions about your healthcare. Stay tuned and learn how to protect your kidneys while effectively treating other medical conditions. Before we dive in, kindly note that all information you'll find in this video is produced by humans and for humans. Be assured our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. All right, it's time to swing back to the medications that can be harmful for your kidneys. 7. Antibiotics. Antibiotics are prescribed often, but they are not without risk. Does your doctor prescribe antibiotics for your sore throat, skin infection, or other infection? If so, it could be harming your kidneys. First, let's take a look at what antibiotics are. Antibiotics, also known as antibacterials or antimicrobials, are a group of medications designed to combat bacterial infections. They work either by killing bacteria or preventing them from reproducing. You can find common antibiotics with the brand names like Cipro, Augmentin, Flagyl, Bactrim, or amoxicillin. These drugs could be prescribed to treat strep throat, pneumonia, urinary tract infections, or UTIs in short, or skin infections. Antibiotics can treat these bacterial infections, but they can't treat viral infections, such as colds, flu, bronchitis, most coughs, and most sore throats. So you should be extra cautious when your doctor prescribes antibiotics. If prescribed improperly, you might experience side effects such as diarrhea and liver and kidney problems. Even when properly used, some antibiotics, such as polymyxins, aminoglycosides, and vancomycin, can harm your kidneys. Simply put, your kidneys play a crucial role in removing antibiotics and other drugs from your body. But beware. Antibiotics like polymyxins may damage kidney cell membranes, possibly causing kidney injury. Similarly, another antibiotic, aminoglycosides, can accumulate in kidney cells, causing cell death and harming kidney tubules. In general, the mechanism by which each antibiotic causes kidney injury is still not fully understood, but it might involve inflammation and harm to kidney cells. For antibiotics to be effective and safe for kidney health, it's important to use them correctly. Did you know that nearly 1/3 of antibiotics prescribed in the United States aren't even appropriate for the conditions being treated? That's according to a report from the Centers for Disease Control and Prevention, or CDC in short, and a study published in the Journal of the American Medical Association. Before you ask for an antibiotic or if your doctor prescribes one, knowing which conditions they can treat is important. You can ask them, "Is this necessary?" And most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage exactly as instructed and adhere to any food requirements. Even if you feel better, never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 6. Nonsteroidal anti-inflammatory drugs, or NSAIDs in short. Some may not recognize nonsteroidal anti-inflammatory drugs, but have you heard of ibuprofen, aspirin, Motrin, ketorolac, celecoxib, or naproxen? Yes, they're all NSAIDs, and you can purchase some of them without a prescription. In fact, NSAIDs are very common. Over 30 million people take them daily. NSAIDs are commonly used to ease headaches, sprains and strains, colds and flu, and pain from arthritis. At their core, NSAIDs mainly work by blocking an enzyme called cyclooxygenase, or COX in short. This enzyme helps produce pain-causing substances. However, COX is also important for protecting the kidneys during stress and helping regulate sodium and water excretion. So, when NSAIDs block COX, it's a big reason why these drugs can harm your kidneys. In fact, all NSAIDs can cause acute kidney injury, or AKI in short, especially in older people, and when taken in high doses or overextended periods. This injury appears in two main ways. One because blood flow changes, and the other because of inflammation, both caused by blocking COX. First, blocked COX can narrow kidney blood vessels, reducing blood flow. This can lead to fluid retention, high blood pressure, and even mild temporary kidney impairment. If this goes unchecked, it might cause more severe issues like acute tubular necrosis, where kidney tubules die due to lack of oxygen and acute kidney failure. Even though this can initially look like acute kidney failure, it could eventually progress to chronic kidney disease. Second, although NSAIDs are anti-inflammatory drugs, prolonged use can trigger inflammation in kidney tubules, the tiny structures that filter waste. This inflammation is rare, but overall, kidney issues stemming from NSAIDs are a big concern, affecting 1% to 5% of daily users worldwide. This means that each year, around 500,000 to 2.5 million people experience kidney injury from NSAIDs. What's worse, these drugs are often involved in hospital admissions because of adverse drug events, some of which can be deadly. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 10,184 people who were prescribed NSAIDs for various conditions. The results showed that NSAIDs use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. This result emphasizes the need for caution when prescribing and using these medications. In another study, scientists looked at 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients' kidney function decreased after NSAIDs use, but returned to normal after switching to another pain reliever drug. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Now, the next set of drugs on our list might surprise you because they're typically considered pretty good for your kidneys. 5. Diuretics. Diuretics help with conditions like fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common diuretics includes hydrochlorothiazide, or HCTZ, bumetanide in Bumix, furosemide, sold as Lasix, spironolactone, found in Aldactone, and acetazolamide in Diamox. They work by increasing urine output. They're also good for expelling excess salt and water through urine, which can help with hypertension or high blood pressure, a leading risk factor for kidney disease. Thus, diuretics are generally suitable for your kidneys. While diuretics are beneficial overall, they don't come without risks, especially concerning kidney health. In fact, they don't directly damage the kidneys or affect their filtering function like NSAIDs. Instead, they act further down the kidney's process, altering the urine's concentration and composition. This increases the amount of urine or changes the levels of electrolytes in it. So, excessive use or high doses of diuretics can lead to dehydration, a risk factor for kidney damage. A study looked at 131 patients using diuretics and having acute kidney injury from 1999 to 2010 at a hospital. At first, 96.2% of the patients already had at least one health issue before starting diuretics, with chronic kidney disease, or CKD in short, being the most common at 55.0%. They found that patients who used diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the bigger the risk. Also, about 27.5% of the cases of acute kidney injury were caused by diuretics alone, while others were due to a combination of diuretics and other drugs. So always consult your doctors before starting new medications with diuretics. For people with CKD who are taking diuretics, it's important to stay hydrated and regularly check for electrolytes and kidney function. Nowadays, there are more home testing options available than ever before, so people can now check their kidney function from the comfort of their own homes. 4. Proton pump inhibitors. Proton pump inhibitors, or PPIs in short, are widely used medications available over the counter. These drugs effectively treat conditions like gastroesophageal reflux disease, or GERD in short, or acid reflux by reducing stomach acid production. This is because PPIs target an enzyme in the stomach called hydrogen potassium ATPase, or proton pump, which is crucial for acid secretion. Although PPIs are generally safe and great at soothing acid-related discomfort such as heartburn, they still carry risks, particularly for kidney health. For example, PPIs have been linked with acute interstitial nephritis, or AIN in short, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Even though only a tiny number of PPI users develop AIN, this drug has become a common cause of drug-induced AIN in developed countries. More concerning, AIN caused by PPIs often shows no apparent signs and often goes unnoticed. So, long-term PPI use may lead to lower kidney function and acute sudden kidney injury. Over time, this can even progress to CKD. An often overlooked side effect of long-term PPI use is low magnesium levels in the blood or hypomagnesemia, which is linked to CKD. Simply put, hypomagnesemia can disrupt your electrolyte balance and cause inflammation, triggering kidney disease. Low magnesium can also lead to other serious health problems, including muscle spasms, seizures, and irregular heartbeats. A 2019 cohort study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. This study checked how PPI use relates to new cases of acute kidney injury, or AKI in short, and chronic kidney disease in a large group of people. When they examined a group of 93,335 people, they found that those taking PPIs had a 4.35 times higher risk of AKI compared to those who didn't. Similarly, taking PPIs was linked to a higher risk of CKD. When researchers examined a group of 84,600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. So, people taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. After all, don't let the solution to one problem become the source of another. While PPIs can provide significant relief from acid-related issues, long-term use of them can harm your kidneys and cause other problems, such as infections, fractures, or nutritional deficiencies. So, it's important to take PPIs for the shortest time possible to relieve acid-related issues without raising the risk of side effects. 3. ACE inhibitors. Angiotensin-converting enzyme, or ACE in short, inhibitors, are prescription medicines widely prescribed to lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors are lisinopril, sold as Zestril, Prinavil, Ramipril, found in Altace, enalapril in Vasotec, and benazepril in Lotensin. These drugs work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By stopping this enzyme in its tracks, ACE inhibitors help relax blood vessels, thereby lowering blood pressure and reducing stress on the heart. Normally, ACE inhibitors also improve blood flow to the kidneys, easing the workload on these vital kidney-shaped organs. This enhanced blood flow can protect the kidneys, especially over the long term. Moreover, ACE inhibitors may help reduce the presence of protein in the urine, a common problem in chronic kidney conditions. In fact, ACE inhibitors are commonly recommended for people with kidney disease. While these medications boast protective benefits, they're not without risks. When you mix them with NSAIDs and diuretics, your risk of AKI can increase. Also, when you don't drink enough water to meet your body's needs, taking ACE inhibitors can put you at more risk of AKI. If you're concerned about your risk of AKI when taking these drugs, it's best to talk to your doctor about ways to lower it. Some people are concerned that ACE inhibitors might decrease your estimated glomerular filtration rate, or eGFR. Typically, a higher eGFR suggests better kidney function. However, ACE inhibitors reduce eGFR by relieving pressure on the kidneys, allowing the small filters called glomeruli to relax. While this may cause a slight decline in eGFR, it doesn't indicate kidney trouble. It simply means the kidneys are relaxing. However, sometimes eGFR may drop too much. This is especially risky in patients with heart failure, chronic kidney disease, or blockage in both renal arteries, or bilateral renal artery. If this occurs, your doctor may adjust your dosage or stop the medicine temporarily to find the cause. Note that in rare cases, particularly in patients with conditions like heart failure or severe dehydration, ACE inhibitors can cause acute renal failure. However, once stopping the medication, most patients recover without lasting kidney damage, even after needing dialysis. So, patients with heart failure, diabetes, or CKD benefit from ACE inhibitors because they ease the strain on the kidneys and offer long-term kidney protection. However, dosages should be adjusted carefully, and kidney function should be regularly checked. 2. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting infectious diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can clear the flu and combat other viruses from your body. For a flu, two common antiviral drugs are oseltamivir, Tamiflu, and zanamivir, Relenza. In contrast, for chronic infections like HIV, hepatitis, and herpes, antivirals can't cure them completely, but they can ease symptoms and reduce their severity. Antiviral drugs offer many benefits in treating viral infections, yet their potential to harm the kidneys cannot be overlooked. This risk, whether from direct toxicity or crystal buildup that can cause kidney stones, is a serious concern. Careful management and customized treatments are necessary, especially for people with existing kidney problems. Let's take, for example, remdesivir, a drug for emergency use in COVID-19 cases. Remdesivir contains a substance called SBCD, which is mainly removed from the body by the kidneys. In people with kidney issues, SBCD might build up and cause kidney toxicity. Some clinical trials have inconsistently reported a decrease in kidney function with remdesivir. Moreover, data from global databases showed a significant increase in cases of acute kidney failure associated with remdesivir compared to other COVID-19 drugs. However, there hasn't been enough large-scale clinical data to confirm whether remdesivir is safe or harmful for people with kidney issues, so further studies are necessary to provide clarity in this area. Besides remdesivir, the use of more effective antiviral drugs often leads to drug-induced acute kidney injury. Some antiviral drugs like cidofovir, adafovir, foscarnet, acyclovir, interferon, and tenofovir can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins. This condition is called acute tubular necrosis. Additionally, the antiviral drug atazanavir can cause inflammation in the interstitial tissue of the kidneys, impairing kidney function. Also, acyclovir, indinavir, and foscarnet can cause crystals buildup in the kidneys, blocking the kidney tubules. In contrast, some antiviral drugs like Viread and foscarnet can help manage kidney damage, but they also pose a notable risk of kidney failure. Therefore, taking these drugs under close medical supervision is crucial to safeguard the kidneys. Also, to safely use antiviral drugs, never skip doses or inconsistently take them. This practice can lead to virus adaptation, making the antiviral less effective. This is called antiviral resistance. Also, note that antiviral drugs are only available with a prescription, so don't buy them online or from unofficial sources. 1. Lithium. Lithium is a prescription medication for mood stabilizing and certain mental illnesses. These mental problems include mania, where one feels highly excited, overactive, or distracted, and bipolar disorder, which causes mood swings between extreme highs, also known as mania, and lows or depression. Some brand names of lithium are Priadol, Camcolit, Lisconum, and Liquid. For over 60 years, these drugs have enhanced the lives of many individuals suffering from bipolar disorder. While lithium can be a lifeline for calming mood, its impact on the kidneys cannot be ignored. Long-term use of lithium can lead to some serious kidney issues, including both acute and chronic kidney disease, as well as kidney cysts. Early on, kidney damage from lithium might be reversible, but it could become permanent with time. The main issue with lithium use is a type of diabetes linked to kidney damage called nephrogenic diabetes insipidus. This isn't your typical diabetes caused by high blood sugar. In this condition, your kidneys can't respond properly to a hormone called antidiuretic hormone, or ADH, which controls fluid balance. The result? One may have excessive thirst and too many trips to the bathroom. In rare cases, long-term use of lithium can even lead to end-stage renal disease, or ESRD. Symptoms of kidney trouble from lithium include excessive urine output and thirst, frequent nighttime urination, and signs of dehydration like low blood pressure and fast heartbeat. In severe cases, it can cause changes in mental status. Moreover, lithium can make the kidneys excrete too much sodium, a condition known as hyponatremia. Sudden hyponatremia, where sodium levels drop quickly in less than 48 hours, can cause serious problems if not treated, including life-threatening muscle breakdown, rhabdomyolysis, severe confusion, seizures, coma, and even death. So, patients should maintain a regular diet with enough salt and fluids while taking lithium. Moreover, when on lithium, it's important to define a suitable dosage. Get yearly blood tests to check creatinine levels and seek medical help if anything seems wrong. Lithium can harm you in many ways, not just by damaging kidneys. So, before starting it, let your doctor know if you have kidney, heart, thyroid, or breathing problems, Addison's disease, or Brugada syndrome. Extra tips for cautious use. Do you suspect that your medication is affecting your kidney health? It's important to seek medical advice right away. Symptoms of kidney failure might not be apparent initially, but as the condition worsens, signs such as decreased urine output, swelling in the legs, shortness of breath, and severe fatigue become more evident. If untreated, the consequences can be life-threatening. Let's ensure you remember these symptoms to know when to act. If you are taking any of the medications that have been discussed in this video, check your kidney function regularly using tests that include blood creatinine levels, glomerular filtration rate, or GFR in short, and urine tests for protein. Proper hydration helps your kidneys clear sodium, urea, and toxins from the body, which can mitigate the impact of nephrotoxic drugs. Be aware of potential interactions between your prescriptions that could impact your kidney health. Share all your current medications with any healthcare provider who prescribes a new drug. Yes, medications are essential for treating various medical conditions. Yet certain drugs pose significant risks to kidney health and should be used cautiously, especially in individuals with existing kidney disease or those predisposed to kidney disease. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, and lithium all have the potential to impair kidney function through mechanisms ranging from direct toxicity to effects on renal blood flow and electrolyte imbalances. For those with kidney disease, it is crucial to avoid or carefully manage the use of these medications. Patients should work closely with healthcare providers to select treatments that minimize risk to the kidneys, adjust dosages as necessary, and monitor kidney function regularly. A healthy lifestyle can help you keep medication to a minimum. Try to eat a balanced diet with lean protein, fruits and vegetables, and exercise regularly to protect your kidneys from any damage. Avoid these 18 worst daily habits that can destroy your kidneys fast. Are you unknowingly destroying your kidneys with your daily routines and habits? Some seemingly harmless activities, through daily repetition, can silently kill your kidneys, putting your life at risk. So don't go about your day without learning what those bad habits are. The fact is, 90% of Americans don't notice kidney problems until they become serious. Our bodies often mask early kidney disease, with severe damage occurring before symptoms surface. So, when the symptoms do appear, for example, you may feel swelling, brain fog, fatigue, weakness, muscle twitches and cramps, back pain, etc. It can be too late already, as kidney disease in its later stage is tougher and expensive to treat. It's crucial to note that most cases of kidney damage cannot be repaired, especially chronic ones. If kidneys struggle, toxins will build up inside your body, leading to multiple types of health problems and terrible, terrible pain. The worst scenario is kidney failure, where you would need dialysis or a kidney transplant to stay alive. Now, here is a simple game changer: your lifestyle. Good daily habits can safeguard your kidneys while others silently harm them. It's your choice. Risk kidney damage with harmful habits or make informed decisions to protect your kidney health. But before making any changes, understanding is essential, and we are here to reveal the 18 worst daily habits that can destroy your kidney fast. In the next few minutes, we'll not only point out these harmful habits, but also give you practical tips and solutions to keep your kidneys healthy. Brace yourselves for some shocking revelations. 18. Excessive salt intake. Imagine a quiet threat hidden in your everyday meals, one so common that it's often overlooked: too much salt. Salt, or sodium chloride, is essential for many bodily functions. However, high salt intake poses a daunting challenge for the kidneys, which filter waste from your blood. The issue begins with hyperfiltration, where the kidneys work overtime to remove excess salt. Simply put, salt molecules are heavy for passage through the kidney nephrons, causing higher glomerular pressure. This extra workload doesn't just tire out the kidneys, it can lead to kidney damage and disease. Moreover, a high sodium intake can reduce the effectiveness of certain kidney-protecting drugs, such as angiotensin-converting enzyme inhibitors and calcium antagonists. Also, consuming too much salt can disrupt the delicate balance between sodium and potassium, further decreasing kidney function. The World Health Organization, or WHO, recommends consuming less than 2 grams of sodium per day per person. However, Americans currently consume 50% more salt than the recommended daily limit. Processed foods such as instant noodles, canned goods, and pickles are high in sodium and can harm your kidneys. To maintain good kidney health, try cutting down on sodium and flavoring your food with herbs and spices instead of salt. For example, instead of using garlic salt, go for garlic powder. Plus, try making a habit of reading food labels. When you're shopping, go for fresh meats, fruits, and veggies, which tend to have less sodium than packaged options. It typically takes about 6 to 8 weeks for your taste buds to get used to lower sodium levels. But once you adjust, you may find that your previously enjoyable foods like potato chips taste too salty. 17. Excessive sugar intake. The transition from a sweet treat to a bitter kidney outcome begins when blood sugar levels rise above 180 milligrams per deciliter. At this critical threshold, your kidneys, to manage the overload, start secreting sugar into your urine. This might sound like a safety valve, but it's actually the starting point of potential kidney damage. The high sugar content in your bloodstream can harm the tiny blood vessels in your kidneys, impairing their filtration ability. This damage can manifest as proteinuria, where your body loses valuable proteins in urine. Over time, proteinuria can advance to chronic kidney disease, and if not managed well, it could even progress to end-stage renal failure. Moreover, the ripple effect of high sugar intake raises blood pressure, putting additional strain on the kidneys. This increased workload can speed up the development of chronic kidney disease and even end-stage renal disease, or ESRD in short. Excessive sugar intake poses a significant risk to kidney health, as highlighted in a study published by Frontiers in Nutrition in 2023 and reported by Harvard Health. The study followed 28,303 adults for 11 years and revealed an 88% higher risk of developing kidney stones in people who got 25% or more of their daily calories from added sugars compared to those who ate less sugar. This research underscores the need to cut down on added sugar to safeguard kidney health and prevent kidney stone formation. To minimize the health risks associated with excessive sugar intake, limit processed foods and sugary drinks, which often contain high levels of added sugars. Instead, go for whole foods and natural sweeteners. A kidney-friendly diet should include plenty of fruits, vegetables, healthy fats, and lean proteins while cutting back on salt, sugar, and refined carbohydrates. 16. Excessive meat intake. Too much consumption of meat, particularly red meat, generates more acid load during digestion than plant-based proteins. This extra acidity can strain the kidneys and may contribute to both the development and acceleration of chronic kidney disease. Over time, this condition can lead to kidney failure. Substituting red meat with other protein sources, such as fish, poultry, or plant-based options, can greatly lower the risk of kidney damage. Plant-based proteins and lean meats like poultry and fish are better choices. This is because they produce less dietary acid and fewer harmful byproducts like advanced glycation end products and uremic toxins. A study from 2017 found that a high intake of acid-producing red meat, in combination with a low intake of base-producing plant proteins like chickpeas, broccoli, or beans, could induce kidney injury. These findings suggest that excessive meat intake could be bad for kidney health and could lead to CKD and ESRD even in individuals without identifiable risks. So, it's a good idea to swap out red meat for plant-based protein sources, such as soy and legumes, to help protect kidney health. Another harmful effect of eating too much meat is the production of uremic toxins in the gut, such as trimethylamine N-oxide, or TMAO in short, indoxyl sulfate, and p-cresyl sulfate. These toxins are linked to a higher risk of death from heart problems and could speed up the progression of kidney disease. Furthermore, a high protein intake, especially from animal sources, can harm your kidneys by raising blood flow and pressure in them. This can cause glomerular hyperfiltration, which may speed up the progression of chronic kidney disease. Current dietary guidelines recommend a protein intake of 0.6 to 0.8 grams per kilogram of body weight per day if you have chronic kidney disease but aren't on dialysis. If you are on dialysis, it's recommended to eat 1 to 1.2 grams per kilogram of body weight per day. 15. Excessive strenuous exercise. Too much intense exercise can lead to kidney damage in different ways. One primary cause is rhabdomyolysis, a condition where intense workouts make muscle cells break down, releasing a protein called myoglobin into the bloodstream. This protein can hurt your kidneys. Factors that increase the risk of rhabdomyolysis include dehydration, certain muscle conditions, use of pain relievers like nonsteroidal anti-inflammatory drugs, NSAIDs, heavy drinking, hot weather, and how hard you exercise. A 2022 study published by the Sport Journal looked at how different types of exercise affect kidney diseases. They found that moderate intensity and long-term exercise is generally beneficial for patients with acute and chronic kidney disease. In contrast, strenuous exercise, especially if you don't drink enough water and it's hot outside, can cause sudden kidney damage and make kidney diseases worse, possibly leading to kidney failure. Furthermore, endurance events can cause acute kidney injury, or AKI, due to pigment nephropathy. This occurs when myoglobin from damaged muscles and hemoglobin from damaged red blood cells cause kidney blood vessels to narrow. This narrowing can harm the kidney tubes, directly causing tubular toxicity. This type of kidney injury is more likely in dehydrated people, those with rhabdomyolysis, or those who use drugs like NSAIDs. We've got more details on that coming up in the next section. To break the habit of excessive strenuous exercise and protect your kidney health, listen to your body. Slow down if the exercise feels too hard, if you feel muscle or joint pain, if it is difficult to talk due to heavy breathing, if your heart is racing, or if you don't recover within an hour after exercising. It's smart to use an app to monitor your progress and adjust your exercise routine as needed. 14. Overuse of painkillers. Overuse of painkillers can harm your kidneys, a condition known as analgesic nephropathy. This often occurs from long-term use of pain relievers or analgesics, especially those over-the-counter drugs with acetaminophen or NSAIDs, such as aspirin, ibuprofen, or naproxen. People who self-treat with over-the-counter painkillers for chronic issues such as headaches or arthritis should be cautious. Even though these medicines are easy to get, they shouldn't be taken daily or regularly without consulting your healthcare provider first. Thousands of Americans have damaged their kidneys by using these medicines regularly for too long. For people with chronic kidney disease or end-stage renal disease, ESRD in short, NSAIDs pose a big threat because they can decrease blood flow to the kidneys, impair kidney function, and potentially lead to kidney failure. Moreover, NSAIDs may elevate blood pressure, exacerbating kidney damage in these patients. Symptoms of kidney damage from painkillers include feeling tired, needing to pee more often, seeing blood in the urine, having back pain, making less urine, feeling less awake, like feeling sleepy, confused, or tired, having less feeling or numbness, especially in the legs, feeling nauseous, vomiting, bleeding, and swelling all over the body. 13. Ignoring the urge to urinate. Ignoring the urge to urinate, which is often called ignoring nature's call, can lead to several health issues, including damage to the kidneys. When pee or urine doesn't empty completely from your body, it can lead to a condition called hydronephrosis, where one or both kidneys swell. Without treatment, severe hydronephrosis can cause kidney failure. Continuous postponement of urination increases the risk of urinary tract infections, UTIs in short, because the bladder, when overly full, becomes a breeding ground for bacteria. These infections can then spread to the kidneys and hurt them. Moreover, keeping pee in for a long time can cause the bladder to overstretch, which may harm the bladder itself and put more pressure on the kidneys, potentially resulting in kidney damage. Also, not going to pee when you feel the urge can cause tears in the bladder wall. Over time, this can make your bladder hold less pee and make urinary tract infections happen more often, which can complicate further into kidney infection or sepsis. To maintain kidney health and manage the urge to urinate effectively, take regular bathroom breaks and go when you feel the urge, without holding it if it feels uncomfortable. Urinate right after waking up to start your day and set a regular urination cycle. You can schedule regular bathroom breaks by setting alarms to remind yourself to go every 2 to 3 hours. This simple tip can help relieve pressure and prevent emergencies. 12. Ignoring urinary tract infections. Urinary tract infections, or UTIs in short, are bacterial infections that affect parts of the urinary system, such as the bladder, ureters, kidneys, or urethra. Most urinary tract infections are treatable with antibiotics, but neglecting to address the symptoms can allow the infection to get worse. If left untreated, the infection may spread to the kidneys, a condition called pyelonephritis. This can cause permanent kidney damage or even sepsis, a life-threatening response to infection. The urinary system plays a vital role in filtering waste and balancing fluids in the body. However, in urinary tract infections, when bacteria build up in the urinary tract, they can cause infections. These infections lead to symptoms like pain, frequent urination, a burning sensation, cloudy or bloody urine, and a persistent urge to urinate. A 2014 study in the Turkish Journal of Medical Sciences looked at 276 people with bacteria in their urine, or bacteriuria patients, and focused on urinary tract infections in those with chronic kidney disease. The research highlighted that elderly chronic kidney disease patients, especially women with kidney stones, were more susceptible to upper urinary tract infections. So, if you have symptoms of a urinary tract infection, like burning or pain when you pee, it's best to seek medical attention. Your doctor may also test you if you have other urinary or kidney problems, such as kidney stones. Chronic kidney infections can lead to severe complications, such as pyonephrosis. Pus fills up the kidney, potentially resulting in the loss of kidney function. 11. Ignoring high blood pressure. High blood pressure harms the kidneys by damaging the blood vessels that bring blood to them. This damage makes the vessels stiff, reducing blood flow to the kidneys and making them not work as well. Furthermore, the tiny blood vessels inside the kidneys that filter blood may also suffer damage. The relationship between high blood pressure and kidney damage is a big concern because it damages the nephrons, the microscopic structures that filter blood within the kidneys. When the blood vessels feeding the nephrons get hurt, they do not receive enough oxygen and nutrients, leading to further kidney impairment. This creates a detrimental cycle, where kidney damage makes it harder to control blood pressure, which in turn can lead to kidney failure. A study published in the American College of Physicians Journal in 2005 explored how high blood pressure affects kidney disease in different ethnic groups. The research, involving 1,172 participants, found that the risk of kidney failure was 32% lower in the low blood pressure group compared to the usual blood pressure group. Similarly, the risk of kidney failure or death was 23% lower in the low blood pressure group. This study highlights how important it is to find and treat high blood pressure early to prevent kidney disease. Preventing kidney damage from high blood pressure needs long-term management strategies. Lifestyle changes such as increasing physical activity, staying at a healthy weight, quitting smoking, managing stress, and eating less salt are crucial in lowering blood pressure. These changes can really cut down on the risk of developing kidney damage. Additionally, medications specifically designed to lower blood pressure, such as angiotensin-converting enzyme, ACE in short, inhibitors and angiotensin receptor blockers, ARBs in short, play a key role in slowing the progression of kidney disease related to high blood pressure. 10. Poorly managed diabetes. High blood sugar levels linked with diabetes can cause damage to the blood vessels and nephrons within the kidneys, the tiny structures that filter blood. This harm can impair kidney function, leading to chronic kidney disease. According to the National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK, diabetes is the leading cause of kidney disease. About 1 out of 3 adults with diabetes have kidney disease. The National Kidney Foundation, or NKF, also emphasizes that diabetes is a major risk factor for CKD. So, the longer someone lives with diabetes, the more likely they are to develop kidney disease. This connection highlights the importance of managing diabetes well to prevent diabetic kidney disease, or DKD, which can progress to end-stage renal disease, or ESRD, if not treated right. High blood pressure, a common complication of diabetes, can further damage the kidneys by harming the blood vessels needed for filtering and regulating, as we mentioned in the previous section. Therefore, managing diabetes effectively also means controlling blood pressure, along with blood sugar and cholesterol levels. This comprehensive approach should include a healthy diet, regular exercise, adherence to prescribed medications, and regular medical checkups to monitor kidney function. 9. Skipping regular exercise. Exercise offers numerous benefits for people with kidney disease, including improved blood pressure control, better sleep quality, enhanced physical strength, and reductions in anxiety and depression. Conversely, not exercising regularly can take away these benefits and may even worsen kidney function. But as we mentioned before, it is important to remember that while exercise is beneficial, intense physical activity, especially in hot weather, can lead to dehydration and exacerbate kidney issues. Therefore, moderation and appropriate exercise routines are critical for individuals with kidney concerns. Studies have long shown that not being active enough can lead to decreased strength and exercise capacity, which is commonly seen in patients with CKD. A review from Cochrane in 2011 explored the benefits of exercise training for adults with CKD. The review, which included 45 studies with 1,863 participants, found that regular exercise makes you fitter, increases aerobic capacity, and increases the amount of oxygen your body can use by about 56%. Additionally, exercise reduces blood pressure and heart rate while enhancing health-related quality of life. These data show how important it is to make lasting changes in your life to be more active and improve kidney health. To overcome the habit of skipping regular exercise and support your kidney health, each week, try to do at least 30 minutes of moderate activity like running, cycling, walking, or dancing. If you're new to exercise or have kidney issues, start with small, gentle movements and gradually increase intensity to avoid injury. Consistent, short sessions often work better than infrequent, long ones. Here's a handy tip to keep you motivated and on track. Use a journal or online app to track your progress and set fitness goals. Then, celebrate your achievements with rewards that aren't food to keep yourself excited. Plus, choose enjoyable activities like gardening, raking leaves, or seasonal fruit picking. Exercise with friends, family, or colleagues for extra motivation and support. You could even kickstart a walking club at work or schedule regular walks with a friend to make fitness a fun and social habit. 8. Drinking sodas. You might be aware that sodas aren't great, but do you realize just how much they can harm your kidneys? Drinking sodas, particularly colas, can increase the risk of getting CKD due to their lots of sugar and phosphoric acid. The high sugar content in sodas can contribute to obesity, diabetes, and cardiovascular disease, all of which are risk factors for CKD. Also, the phosphoric acid in cola beverages can lead to urinary changes that increase the likelihood of forming kidney stones, another thing that makes CKD more likely. A 2014 study published in the journal Nephrology Dialysis Transplantation systematically reviewed 17 studies to examine the link between different types of soda and CKD. They found that regular consumption of sugar-sweetened soda was linked with a 58% increased risk of CKD. Even drinking artificially sweetened sodas regularly made the risk of CKD 33% higher compared to not drinking them. So, reducing soda intake may help stop CKD. Instead, choose healthier beverage options like water, unsweetened tea, or low-fat milk to reduce the risk of CKD. 7. Eating processed foods. Consuming processed foods, especially ultra-processed foods, or UPFs in short, can significantly impact kidney health. UPFs are industrial formulations that have lots of artificial additives, added sugars, refined carbohydrates, unhealthy trans fats, and too much salt. These ingredients make processed foods very tasty and hard to resist, possibly leading to overeating. Worse still, processed foods are typically low in beneficial nutrients like fiber and micronutrients. These foods may even contain contaminants from packaging processes. Research highlights that eating a lot of UPFs can be really bad for your kidneys. A study in the American Journal of Kidney Diseases found that people with chronic kidney disease who eat more UPFs are more likely to have their kidney disease get worse and even die. This study underscores the importance of dietary choices in managing kidney health. To protect kidney health, it is advisable to reduce the intake of UPFs and focus on fresh, whole, and homemade foods. Another 24-year study tracked over 14,000 adults from the U.S. without CKD at the start. People who ate the most UPFs had a 24% higher risk of CKD compared to those who ate the least. Also, replacing just one serving of UPFs with minimally processed options lowered the risk of CKD by 6%. So, reducing the consumption of such processed foods can greatly help mitigate the risk of kidney-related issues. To improve kidney health and lessen the harm from processed foods, drink plenty of fluids to help your kidneys flush out sodium and toxins and prevent kidney stones. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can also support healthy kidneys and lower your chances of related conditions like high blood pressure and diabetes. Writing down what you eat in a food journal can help you see your habits and make healthier choices. Plus, a renal dietitian can provide valuable guidance on making these dietary adjustments to support your kidney and overall well-being. 6. Sitting for too long. The relationship between sitting time and kidney disease persisted, even after accounting for other factors such as age, gender, smoking status, and levels of physical activity. Studies showed that people who sat the least had the lowest risk of developing CKD, no matter how much they usually exercise or how much they weigh. A study from 2022 in the Sports Medicine Journal analyzed data from 455,506 participants over 21 years. This research found that prolonged sitting at work was linked with a higher risk of kidney problems, including a 26% higher risk of chronic kidney disease, a 19% higher risk of needing dialysis, and a 43% higher risk of death from kidney issues. Even a little exercise, like just 15 minutes a day, helped reduce these risks. So it is important to cut down on sitting around to maintain kidney function. Here's a smart tip. Even when you're sitting, you can sneak in some exercise. Try keeping a small bottle of water on your desk. Not only will it keep you hydrated, but when it's empty, it's a good reminder to get up and refill it, giving your body a break from sitting. It's like getting two benefits in one for your kidneys. 5. Not drinking enough water. Dehydration occurs when the body loses more water than it takes in, leading to an imbalance of vital electrolytes such as potassium, phosphate, and sodium. These electrolytes are essential for carrying electrical signals or messages between cells. So, if they're not balanced due to inadequate kidney function, it can cause severe health problems, including seizures, involuntary muscle movements, and loss of consciousness. Severe dehydration can even make your kidneys fail, which is life-threatening and can lead to anemia, central nervous system damage, heart failure, and a weaker immune system. Additionally, dehydration can make kidney stones more likely, complicated UTIs, and increase the risk of CKD. So, it is crucial to maintain hydration by keeping your body water levels stable day to day to avoid significant water deficits. Proper fluid intake isn't just about replacing what you lose. It also helps your kidneys get rid of waste, which is a big job they do. However, it's also risky to drink too much water, especially in individuals with kidney problems. When your kidneys do not function properly, waste builds up and excess fluids can dilute important electrolytes, leading to nausea, vomiting, headache, fatigue, confusion, low blood pressure, muscle weakness, muscle twitching or cramping, restlessness, irritability, seizures, and even coma. The kidneys are crucial for balancing the body's fluids and filter over 200 liters of fluid each day. Their ability to manage water in the body is largely influenced by hormones, such as arginine vasopressin, or AVP in short, and parts of the renin-angiotensin system. When levels of AVP are high, the kidneys reabsorb more water, which can increase their workload. Drinking plenty of water can lower AVP levels, potentially easing the strain on your kidneys and helping to keep them working well. However, researchers are still figuring out whether increasing the amount of urine to protect the kidney's filtering capacity, especially in people with CKD, is a good idea. The results from studies have been mixed. To ensure you're drinking enough water and supporting your kidney health, keep an eye on the color of your urine. You want it to be a straw-colored or paler shade, as darker urine often indicates dehydration. Also, limit your intake of caffeinated, sweetened, and alcoholic beverages, as these require more water to process their toxins and chemicals. Instead, choose plain water to stay hydrated. 4. Smoking. Smoking harms your kidneys in both the short and long term. In the short term, it can raise your blood pressure and heart rate due to nervous system stimulation. Long-term or chronic effects involve harming the cells lining your blood vessels called endothelial cells. Even being around someone else's smoke, passive smoking, has been linked to elevated enzyme catalase activity in the kidneys, which can disrupt normal kidney blood flow and lead to kidney damage over time. Smoking can also lead to less blood flow to the kidneys, causing conditions like peripheral arterial disease and arteriosclerosis, which also affects renal arteries. If you already have CKD, smoking heightens the risks of heart disease, high blood pressure, and diabetes, conditions that can accelerate CKD progression and potentially lead to kidney failure. In a study published in the American Journal of Nephrology in 2007, researchers found a connection between smoking and CKD progression in 11 out of the 12 articles selected, particularly noting that consuming more than 15 packs per year greatly increases CKD risk. Furthermore, smoking has been shown to affect renal functions even in healthy individuals. It is associated with an increased risk of developing proteinuria, which means there's too much protein in your urine, particularly in people with high blood pressure and high blood sugar levels. 3. Not getting enough sleep. Inadequate sleep has been linked with more rapid declines in kidney function and faster progression of CKD. This occurs because sleep helps regulate kidney function and keeps the right balance of bodily fluids and electrolytes. Also, sleep affects the regulation of hormones, including those involved in kidney function, such as the renin-angiotensin-aldosterone system, or RAS in short. The RAS helps regulate blood pressure and fluid balance. Disrupted sleep can overactivate the system, raising blood pressure and putting additional strain on the kidneys. Moreover, a lack of sleep often results in non-dipping blood pressure patterns. Normally, blood pressure dips during sleep, giving the cardiovascular system and kidneys a rest. However, poor sleep can raise nighttime blood pressure, a risk factor for CKD progression. Sleep deprivation has also been shown to increase inflammatory cytokines and activate inflammatory pathways. Chronic inflammation can directly contribute to kidney damage and worsen existing kidney disease. A study published in the Journal of Clinical Sleep Medicine in 2019 aimed to investigate the association between sleep and the incidence of CKD in 194,039 participants without CKD aged 20 years or older between 1996 and 2014. People who slept fewer than 4 hours, 4 to 6 hours, or more than 8 hours had a 45%, 7%, and 12% increased risk of chronic kidney disease, respectively, compared to those who slept 6 to 8 hours. Conditions like sleep apnea, which are common in people not getting enough sleep, can cause further kidney damage. Sleep apnea often leads to repeated nightly hypoxia, or low oxygen levels, which exacerbates kidney function decline. Furthermore, chronic sleep deprivation is associated with several health issues, such as obesity, type 2 diabetes, and hypertension, all of which are risk factors for CKD. These conditions can initiate or worsen kidney damage over time. To combat the habit of not getting enough sleep and protect your kidney health, try these steps. Create a peaceful sleep environment by making sure your bedroom is cool, dark, and quiet. Establish a consistent sleep schedule by going to bed and waking up at the same time every day, even on weekends. Also, regular physical activity and exposure to fresh air can help you fall asleep more easily and enjoy better sleep quality. 2. Excessive alcohol consumption. According to the National Kidney Foundation, excessive alcohol consumption doubles the risk of kidney disease. Alcohol can cause kidney damage because it cannot filter out all the toxins from alcohol fast enough, and it increases the likelihood of high blood pressure, a leading cause of kidney issues. Moreover, alcohol-induced dehydration disrupts kidney function and alters the body's water and mineral balance. Also, a liver disease resulting from alcohol abuse can further harm the kidneys by affecting blood flow to the kidneys and increasing their workload. Worse still, binge drinking can cause acute kidney injury due to sudden spikes in blood alcohol levels. A study published in 2019 in the journal Nutrients investigated the relationship between alcohol consumption and chronic kidney disease. In this study, scientists followed 45,200 adults over 8.5 years and found that heavy drinking increases the risk of CKD by 15%. It's crucial for individuals, especially those with medical conditions or on certain medications, to either avoid alcohol entirely or practice moderation, as excessive alcohol consumption can lead to increased blood pressure that is detrimental to kidney health. 1. Excessive caffeine consumption. Excessive caffeine intake, typically defined as above 400 milligrams per day, especially in individuals with specific genetic variants, like the reference SNP 762551 variant in the CYP1A2 gene, can lead to kidney dysfunction. Caffeine works as a diuretic at higher doses. However, at low to moderate doses, it may actually be kidney protective in healthy people. This happens because caffeine is similar in structure to adenosine, the hormone that affects blood flow in the kidneys. Caffeine is a natural diuretic, which means it stimulates urine production in the kidneys, expelling both water and electrolytes. A study published in the Journal of Renal Nutrients in 2007 found that high levels of daily caffeine consumption may increase the risk of acute kidney injury in thoracic cancer patients undergoing platinum salt chemotherapy who are already exposed to nephrotoxic compounds. Out of 108 patients undergoing chemotherapy, 34 developed AKI, and those patients consuming high levels of caffeine, greater than or equal to 386 milligrams per day, faced double the AKI risk compared to others. Drinking a moderate amount of caffeine is generally okay for your kidneys, but it's essential to be careful, especially if you drink a lot or have kidney issues. To reduce excessive caffeine intake and its impact on kidney health, switch to decaffeinated coffee or tea to enjoy their flavor and potential health benefits without caffeine. Use alternative sources of energy like water, fruits, and vegetables to stay hydrated and receive essential nutrients. Consider limiting or avoiding foods and drinks that naturally contain caffeine. For example, dark chocolate has a high caffeine concentration. Sodas like Coca-Cola and Mountain Dew also contain high levels of caffeine. 8 worst foods that damage your kidneys after 50. Practical tips to avoid them. Did you know that what you ate for breakfast this morning could be affecting your kidney health? As we age, especially after reaching 50, our energy dips in ways it didn't before, and our kidneys become more vulnerable to the everyday foods we eat. Some foods, even ones that might have felt harmless in our younger days, can now quietly add up to cause significant kidney strain. This is where a few small changes in our diets can make a big difference in protecting our kidneys and supporting a better quality of life in our later years. In today's video, we're going to talk about the 8 worst foods for your kidneys after 50. We'll show you exactly how to protect yourself from these foods without making your meal bland. Let's start making more mindful choices to keep your organs working smoothly. 8. Processed meats. That saying, small amounts don't matter, doesn't hold up when it comes to any processed foods. Even tiny portions can harm your health since they're packed with additives and offer little real nutrition, like vitamins or antioxidants. Especially processed meats like bacon, sausages, deli slices, and hot dogs are flavorful and convenient thanks to the additives, but pose a unique set of challenges for anyone, especially those with aging kidneys. Most of these meats are packed with high amounts of sodium to keep them fresh longer and add flavor. When we consume these foods, the sodium load in our bloodstream spikes, which can lead to increased blood pressure and disrupt vascular systems. This forces the kidneys to work harder than usual to balance things out. Also, high blood pressure itself is one of the main causes of kidney damage. Processed meats don't just bring sodium to the table. They also come with saturated fats, nitrites, for example, sodium nitrite is a carcinogenic additive, and phosphorus. For those over 50, when kidney function naturally slows, dealing with these compounds can be especially taxing, adding many layers of stress to your kidneys. To lessen this burden without entirely giving up the savory flavor of cured meats, consider limiting to 1 to 2 servings monthly, 2 ounces per serving, reducing portion sizes, removing visible fat, or opting for fresh protein options like fresh whitefish, home-cooked skinless chicken, legumes, in moderation, tofu, tempeh, quinoa, and mushroom. Try adding smaller portions of processed meats to dishes with fresh vegetables and herbs or spice blends to create a more balanced meal with less sodium. These simple swaps still let you enjoy the flavors you love. 7. Carbonated soft drinks. Carbonated soft drinks are one of the worst types of ultra-processed foods, UPFs. Unlike processed foods, which may simply be cooked, frozen, or canned, UPFs are highly altered products made with industrial techniques and additives like sugar, oils, sodium, potassium, phosphorus, colorings, and protein isolates all are not good for kidneys. Soft drinks have no real nutritional value but are full of sugar, or worse, artificial sweeteners, caffeine, phosphorus, sodium or potassium preservatives, and additives. Sugar and caffeine can dehydrate your kidneys, which adds stress and may even lead to kidney injury. The American Heart Association, AHA, recommends a daily limit of 6 teaspoons of sugar for women and 9 for men. A 16-ounce cola can sneak in nearly 12 teaspoons of sugar, far exceeding those limits. Over the past decade, studies have consistently shown that drinking more carbonated beverages increases the risk of kidney disease or faster kidney function decline. A study of 3,003 Americans found that people who consumed the most soda and sweetened fruit drinks had a 61% higher chance of developing CKD than those who drank the least. A 23-year study of over 15,000 people, average age 54, found that compared to people drinking less than a glass of soda a week, those drinking 5 to 7 glasses per week had a 33% higher risk of developing end-stage kidney disease, or ESRD for short. For those drinking more than 7 glasses a week, the risk shot up to 83%. This is partly due to soda's acidity, caused by carbon dioxide and phosphoric acid. Phosphoric acid is a type of phosphorus your kidneys need to filter out. After 50, kidneys often slow down, making it harder to handle excess phosphorus. This can lead to calcium buildup in your blood vessels or kidneys, which makes blood flow harder, increasing the risk of clots or strokes. Sodas aren't the only ones to be cautious about. Energy and sport drinks, flavored waters, vitamin drinks, slushies, and pre-made smoothies can have similar risks. We recommend avoiding these soft drinks altogether. They come with too many risks for your health. But if you're drinking caffeinated drinks regularly, don't quit them cold turkey as it can cause withdrawal headaches. Cut back slowly. If you enjoy that fizzy sensation, sparkling water, infused with fruits or herbs, is a great substitute. Or else, kombucha's fizz is not only tasty, but also contains probiotics that help turn sugar into beneficial organic acids. 6. Fried foods, baked goods, and instant noodles. Crispy fried foods, baked goods, and instant noodles are highly processed foods, UPFs, and contain high amounts of artificial ingredients and unhealthy trans fats and salt, which can raise blood pressure and cholesterol and lead to water retention and force your kidneys to filter out more waste. This is especially risky as kidneys age and become less effective at filtering. Fresh and instant Oriental noodles have 783 milligrams of sodium per serving, and a serving of bakery products, like a slice of bread or 2 to 3 crackers, can have up to 265 milligrams. And frying is particularly risky. When food is fried, water inside it evaporates, and oil seeps in to take its place. This not only makes the food much higher in fat, but the intense heat from frying also changes the food's natural nutrients. The vitamins and antioxidants that protect our cells get damaged. Additionally, frying or baking at high temperatures produces toxic chemicals, some of which have even been linked to cancer, such as advanced glycation end products, or AGEs for short. The kidneys are responsible for clearing AGEs, and excess AGEs can damage kidney structures. AGEs can also build up in the body over time and cause inflammation and damage to the kidneys. Luckily, there are healthier ways to enjoy your favorite crispy foods. Baking, grilling, dry roasting, or air frying whole foods at home lets you get that satisfying crunch without adding the unhealthy fats and salt. You can replace instant noodles with quick, homemade meals like a vegetable stir-fry or whole grain pasta. You can also try healthier noodles like zucchini, rice, shirataki, or bean-based pasta, and make your own broth with herbs for flavor. If you still go for instant noodles, use only 1/4 of the seasoning packet and add kidney-friendly toppings like veggies or mushrooms. Watch out for prepared grocery items, salad toppings, sandwich spreads, microwave meals, and crispy convenience foods. They can be hard on your kidneys. If you're over 50 and your kidneys are healthy, try to limit these foods to once or twice a month. Choose smaller portions, and skip the combo meals and extra sauces. 5. Canned soups and vegetables. Canned soups and vegetables are common pantry staples and are a quick meal option on busy days. However, just like processed meat, Canned goods are usually packed with sodium to enhance taste or texture and extend shelf life. For aging kidneys, this sodium content can cause water retention, which increases the workload on your kidneys because they must try to expel the excess sodium and maintain fluid balance. Over time, eating high-sodium foods can disrupt the body's natural blood pressure regulation and put your kidneys and heart at risk. The U.S. Dietary Guidelines suggest keeping sodium under 2,300 milligrams a day. That's about a teaspoon, or 5 grams, of table salt. But if you have high blood pressure, diabetes, or kidney issues, especially as you age, try to stay at 1,500 milligrams or less, which is only about half a teaspoon. Here's some food for thought. Canned peas, even after being drained, can have up to 250 milligrams of sodium per 100 grams, while freshly boiled peas have almost none. Similarly, drained canned sweet corn has 270 milligrams per 100 grams, but fresh corn on the cob has only 1 milligram. In other words, canned veggies, even after draining, can sneak in over 10% of your daily sodium limit. And watch out for canned soups. They contain 700 to 1,200 milligrams of sodium per serving, which is 25 to 50% of your daily limit. So what can you do to escape the sodium trap? Note that it's not just about avoiding canned foods. It's all processed options. Ready-made soups, broth, or veggies in cartons or glass jars can still have high sodium, just like canned ones. So read food labels carefully. Choose fresh or frozen vegetables, dried beans, or steam fresh vegetable packages. Make sure they don't have added sauces or seasonings. Prepare nourishing aromatic soups from scratch, as they allow you full control over ingredients. Balance out the effects of sodium by including some sources of potassium in your meals. Kidney-friendly options are egg whites, chicken breast, blueberries, pineapple, carrots, bell peppers, and veggies like broccoli, cauliflower, and cabbage. They provide just the right amount of potassium to help manage sodium and blood pressure without overloading your kidneys. This is especially important for those with chronic kidney disease, or CKD for short, or are on a potassium-restricted diet. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 4. Instant sauces. Normally, UPFs like instant sauces come with 70 to 100% more phosphorus and potassium than less processed options, which can really strain your kidneys and, if overdone, lead to CKD. Worse still, your body absorbs nearly 100% of these chemicals in UPFs, unlike the lower absorption rates you get from plant-based foods, which range from 20 to 50%, or animal-based ones, which range from 40 to 60%. Other additives and chemicals in UPFs transform the food's texture, flavor, and nutritional profile, making them shelf-stable and tempting, but far less natural and nutritious. These foods are often calorie-packed and addictive. When it comes to instant sauces, most store-bought versions fall into UPFs, which explains why they're so hard to resist. Now you might not realize it, but your favorite sweet sauce or dip could be loaded with sodium. A common serving of pasta, such as tomato or pesto sauce, about half a cup, can have anywhere from 150 to 2,000 milligrams of sodium. And just 2 tablespoons, about 30 grams of Oriental sauces, BBQ sauce, salsa, marinades, ketchup, or gravy can pack up to nearly 2,200 milligrams, while the recommended daily limit is 2,300 milligrams. 3. Hard cheese. More dairy means stronger bones isn't always true for those after 50. You may not notice it, but most store-bought dairy products are types of UPFs. Modern diets with UPFs foods tend to be acid-inducing due to their phosphorus and protein content, and hard cheese is high in both. In fact, it ranks among those most acid-producing foods. Hard cheese like Cantal cheese is much more acidic or acid-forming in the body compared to soft or fresh cheese, such as mozzarella, ricotta, cottage cheese, and cream cheese. This is concerning, as in CKD and aging, a high dietary acid load can lead to acidosis, which means your blood becomes highly acidic or has a low pH. To maintain stable blood pH, the kidneys increase acid excretion, but this can contribute to bone and muscle loss and further kidney function decline. Moreover, most cheeses contain 300 to 450 milligrams of sodium per serving, as salt helps keep moisture and stop bacteria growth. Also, the high amount of calcium and phosphorus in hard cheese can be a strain on the kidneys, especially for those aged 50 and above. As kidneys naturally weaken with age, they may struggle to effectively filter out high amounts of these minerals, causing the buildup of calcium phosphate particles and kidney inflammation. Instead of hard cheese, consider plant-based sources of calcium like kale, broccoli, or fortified soy milk. Lower phosphorus plant-based milks also help protect kidney function while providing essential nutrients. 2. Red and organ meat. A modern Western diet, which tends to be heavy on meat and other animal-based foods, is more acidic than plant-based diets. Red and organ meat products have sulfur amino acids, which produce sulfuric acid in the body, making the blood more acidic and putting extra stress on your kidneys as they work to keep everything balanced. In comparison, fruits and veggies contain much less of these acids and even help neutralize the acid with their organic salts. Also, the proteins from red and organ meat require kidneys to work harder to eliminate waste byproducts created during protein breakdown. This process can add strain and can speed up the loss of kidney function, which can lead to hyperfiltration and CKD. Moreover, organ meats and red meat are high in cholesterol and saturated fat, which can drive up your blood cholesterol levels. If you're managing heart health or have high cholesterol, opt for leaner muscle meat. Organ and red meats are also high in purines, which can raise uric acid and worsen gout or hyperuricemia. These conditions are common in CKD. 25% have gout, and 60% have high uric acid. A 2018 review found that while red meat raises the risk for gout and hyperuricemia, foods like dairy, certain veggies, like cauliflower, spinach, and lentil, and soy can lower that risk. So you have plenty of healthy alternatives to balance out red and organ meats without worrying about nutrient loss. Purines, found in those foods, are building blocks of DNA and are actually vital for cell growth and repair. Also, try getting more protein from plant-based sources as they are easier on the kidneys. In fact, replacing red meat with other protein sources, especially soy and legumes, reduce the risk of ESRD by up to 62%. Try to eat beans, lentils, tofu, quinoa, and mushrooms a few times a week. Note that organ meats, such as liver and bones, are also used in common foods like sausages, pâtés, spreads, and stock cubes. 1. Foods containing artificial sweeteners. Artificial sweeteners appear in countless processed foods, especially UPFs, from diet sodas to low-calorie sugar-free desserts. They may seem like guilt-free options as they provide no calories or affect blood sugar. However, they can still impact how your body handles sugar, leading to insulin resistance and prediabetes. They mess with your gut bacteria and make sugary foods taste less sweet over time, worsening blood sugar control and even harm your kidneys. If you're over 50, be extra careful. Your metabolism slows down with age, making you more prone to chronic diseases and dehydration. Research has long linked heavy artificial sweetener use to higher risks of heart disease, obesity, kidney problems, and death. A 2024 study published in JAMA Network Open analyzed data from 127,830 participants over about 10 years. It found that consuming more than one serving daily of sugar-sweetened drinks increased CKD risk by 19%, and artificially sweetened drinks increased risk by 26%. Natural juices were not linked to CKD risk, and replacing one daily serving of sweetened drinks with water or natural juice reduced the risk by 7 to 10%. For a healthier alternative, use a modest amount of monk fruit extract, also known as luo han guo fruit extract, a natural sugar alternative that comes with some antioxidants and won't raise your blood sugar. This natural sweetener allows you to satisfy your sugar craving without compromising your kidney health. Better yet, enjoy the natural sweetness of fruits, or whip up your own treats like date paste, banana mash, sweet potato puree, or applesauce. Just remember, even though fruit sugars come with antioxidants and fiber to soften their impact, they're still sugars. Moderation is the way to go. Avoid these 7 plant-based foods that can damage your kidneys. In recent years, many experts have suggested the benefits of a plant-based diet in reducing the strain on your kidneys. But just because something is from a plant doesn't mean it's good for your kidneys, particularly if you have kidney disease. In reality, some plant-based foods can actually pose risks, and cutting back on them would bring lasting rewards. Watch this video to learn 7 plant-based foods you should avoid to protect your kidneys. 7. Seed oils. Seed oils are plant-based cooking oils obtained from seeds. Examples are rice bran, canola, corn, cottonseed, grapeseed, soybean, sunflower, safflower, and peanut oils. These oils are promoted as valuable lipid sources due to their healthy fatty acid content and bioactive compounds. However, these oils have undergone extensive processing, including bleaching, refining, and heating, to extract and clean them before they can be used for cooking and baking. Refining can strip away essential nutrients like antioxidants and sometimes produce unwanted compounds. One example is trans fatty acids, one of the most harmful compounds for your kidneys and overall health. More concerning, seed oils can contribute to inflammation in the body due to their high omega-6 fatty acid content. Inflammation is the root cause behind a long list of health conditions like kidney disease, arthritis, heart disease, and diabetes. Small amounts of omega-6 fatty acids are necessary for your overall health. However, excessive consumption, typical in Western diets, can disrupt the balance between omega-6 and omega-3 fatty acids, leading to health problems such as kidney damage. Fats are divided into saturated and unsaturated types. Unsaturated fats found in oils like olive oil are healthier, offering benefits such as improved cholesterol and heart health. Saturated fats, found in animal products and some plants like coconut, should be limited. Replacing saturated fats with unsaturated ones can minimize the harm caused by seed oils. Opt for unrefined oils, such as extra virgin olive oil, which retain more natural nutrients, flavor, and aroma. Because they are extracted using methods like cold pressing without high heat or chemicals, unrefined oils are tastier, healthier, more natural, and free from harmful additives. This purity and nutrient retention support overall health, including kidney function. 6. Canned vegetables and canned soups. Canned soups and vegetables are commonly consumed because of their low cost and convenience. However, these foods typically contain high levels of sodium for preservation, which can be problematic for those with kidney disease. When the kidneys are not functioning properly, they cannot effectively filter out excess sodium from the blood. This leads to a buildup of sodium, which can increase blood pressure and put additional strain on the kidneys. It is worth emphasizing that canned foods often contain added sugars or chemical additives. This is why individuals with kidney disease should avoid or limit canned foods, including canned vegetables. Instead, look for fresh or low-sodium alternatives. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Chips and pretzels. Baked chips, despite their reputation as a healthier alternative to the fried version, can still pose risks to kidney health. Baked chips are highly processed and low in fat, making it easy to overeat without feeling full. Pretzels are processed baked bread snacks, which can raise blood sugar levels and promote fat storage. These effects can contribute to kidney damage over time. Potato chips and pretzels are also low in essential nutrients like fiber and protein, and can contribute to weight gain and obesity, potentially damaging your kidneys over time. Worse still, both chips and pretzels can contribute to high sodium intake, which can strain the kidneys by causing fluid retention and elevated blood pressure. High salt intake may worsen already existing kidney damage and increase the risk of cardiovascular complications like heart attacks and strokes. Try to moderate your intake of these foods in favor of healthier snack options to support kidney health. 4. Ketchup. Ketchup is made from tomatoes, which are high in potassium, and excessive potassium intake can be problematic for those with poor kidney function. Also, ketchup is often high in added sugar and sodium, which can contribute to high blood pressure and strain on the kidneys. 1 tablespoon, which is 17 grams, can contain 180 milligrams of sodium and 4 grams, which is equivalent to 1 teaspoon of sugar. It's best to choose options that are low in these ingredients, especially those that don't include high fructose corn syrup. The sugar in ketchup, like high fructose corn syrup, can lead to obesity and insulin resistance, making kidney function worse. Ketchup also has lots of phosphorus, which isn't good for individuals with kidney issues. Too much phosphorus can cause problems since damaged kidneys struggle to filter it out. It's important to avoid other store-bought condiments that might cause similar adverse effects. This includes salad dressing, BBQ sauce, and soy sauce, as they often contain high levels of sodium, sugars, or chemical additives. Rather than topping your favorite summer dishes with these condiments, consider using salsa. Choose fresh, salt-free salsa from the store, or make your own at home. 3. Instant noodles. Instant noodles are pre-cooked, dried noodles that are popular worldwide due to their convenience, long shelf life, variety of flavors, and reasonable cost. However, they are often criticized for being unhealthy due to their high sodium, carbohydrate, and trans fat content and lack of essential nutrients like fiber, vitamins, and minerals. In 2017, Nutrition Research and Practice published a study involving 3,397 college students in Seoul, aged 18 to 29. The study aimed to understand how eating instant noodles affects heart and metabolic health. They found frequent instant noodle intake was linked to elevated levels of blood triglycerides and sugars and increased blood pressure. These effects can potentially cause diseases that lead to kidney damage. Instant noodles are a perfect example of ultra-processed foods, or UPFs for short, which can damage kidney function. UPFs are typically high in calories, refined carbohydrates, sugar, salt, chemical additives, and trans fats, and low in dietary fiber and essential nutrients. A 2022 study published in the American Journal of Kidney Diseases analyzed data from the Atherosclerosis Risk in Communities study, a major research initiative conducted in the United States. This study involved 14,679 middle-aged adults without kidney disease at baseline. After analyzing, the researchers found that each additional serving of ultra-processed foods, including canned soup, was linked to a 5% higher risk of chronic kidney disease, or CKD for short. These findings highlight the potential harm of canned soup and other ultra-processed foods on kidney health. A study conducted in Korea found that people consuming the most UPFs had a higher prevalence of CKD. The results demonstrated that every 6.6% increase in UPF consumption was linked with a 6% higher prevalence of CKD. This association may be due to the harmful ingredients found in UPFs, such as hydrogenated oils and chemical additives, which can cause oxidative stress and inflammation. Frequent consumption of instant noodles can harm the kidneys due to their high phosphorus content, which can raise serum phosphorus levels. Elevated serum phosphorus is linked to increased mortality and cardiovascular events. Efforts are being made to address these concerns and develop healthier versions. In Malaysia, for example, researchers have explored the use of composite flours, incorporating locally available ingredients like seaweed powder to improve the nutritional value and quality of instant noodles while reducing dependence on imported wheat flour. 2. Frozen meals. Pre-packaged vegan-vegetarian frozen meals frequently contain lots of salt, potassium, and phosphorus, which can be bad for patients with kidney disease. Excess salt and other preservatives are often added to make these meals taste better and last longer. Moreover, excessive potassium intake can be problematic for individuals with compromised kidney function, as mentioned earlier, because the kidneys struggle to properly regulate potassium levels in the blood. However, plant-based diets in kidney disease have been shown to be beneficial, as the potassium in fresh whole plants are paired with fiber, which prevents its absorption. Talk with your dietitian about the right plant-based diet for you. Similarly, additives containing phosphorus in processed frozen foods can contribute to elevated phosphorus levels in the blood, potentially leading to bone and heart complications in those with kidney disease. Therefore, frozen meals are generally not a good choice for people concerned about kidney health, especially if consumed regularly. To make frozen meals less harmful to kidney health, choose those with lower sodium and reduced potassium and phosphorus content. This involves carefully reading labels and selecting products with minimal processed ingredients. A better option is to prepare homemade meals using fresh whole food ingredients, allowing for greater control over nutrient intake. Try cooking large batches of kidney-friendly vegetarian or vegan dishes and freezing individual portions for later consumption. By prioritizing fresh, whole foods and mindful meal planning, you can enjoy a kidney-friendly diet while minimizing potential harm. 1. Chocolate bars or energy bars. While cocoa contains phenolic antioxidants and flavonoids that can help support the function of your blood vessels, chocolate bars should be consumed with caution. Chocolate bars have high levels of saturated fats and added sugar. These components contribute to high blood sugar, high blood pressure, and weight gain, which are common triggers for kidney disease. Chocolate bars and energy bars are also considered UPFs, which are linked with an increased risk of CKD and worsened complications in patients with CKD. As mentioned earlier, UPFs are typically high in energy, low in nutritional value, and contain additives that may be harmful to kidney health. Energy bars, often consumed for replenishing electrolytes lost during exercise, can pose significant dangers to kidney health. Similar to energy drinks, they often contain high amounts of sugar to provide a quick energy boost. Also, the combination of high sugar and other additives in energy bars leads to conditions that can cumulatively strain the kidneys. Thus, long-term consumption of energy bars can accelerate kidney damage. Therefore, it is essential to minimize your consumption of these processed bars and consider fresh fruits and other healthier alternatives. Are your kidneys damaged? Healthy kidneys filter about half a cup of blood each minute, getting rid of waste and excess water to produce urine. The urine travels from the kidneys to the bladder through two thin muscular tubes called ureters, one on each side of the bladder. The bladder serves as a reservoir, temporarily storing the urine. Together, the kidneys, ureters, and bladder make up the urinary system. When your kidneys are damaged, waste and fluid build up. Over time, this can lead to kidney disease and kidney failure, which can be either acute or chronic. Acute kidney failure is usually short-term and reversible, while chronic kidney failure is a long-term condition that is progressive. Symptoms of kidney damage can include nausea, vomiting, fatigue, sleep problems, changes in urination, decreased mental sharpness, muscle cramps, swelling of feet and ankles, itchy skin, and high blood pressure. These signs might not manifest until irreversible damage has occurred due to the kidney's ability to compensate for lost function. Kidney problems can cause anemia and bone and mineral disorders, such as hyperkalemia, which can be deadly. Additionally, kidney failure can heighten the risk of heart disease or stroke. Without treatment, kidney failure is fatal. Doctors rely on biomarkers like creatinine levels, glomerular filtration rate, or GFR, and protein in the urine to assess kidney function. Newer biomarkers such as kidney injury molecule and neutrophil gelatinous-associated lipocalin show promise for early detection of kidney damage. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys. Elevated blood sugar from diabetes can cause damage to small blood vessels in the kidneys, which harms the filters. Additionally, cholesterol forms plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes protein loss in the urine. Other diseases and environmental factors can also contribute to kidney damage. Obesity increases the risk of chronic kidney disease, or CKD, by lowering urine pH, causing chronic inflammation, and disrupting fat metabolism. It also worsens high blood pressure, insulin resistance, and glucose intolerance, further raising the CKD risk. Surprise! Drinking water wrongly can damage your kidneys. By wrongly, we mean you can either drink too much or too little water. Both can potentially harm your kidneys. But what's the right amount of water to drink? Many people believe in the old adage that you should drink 8 cups, or about 2 liters, of water daily to stay hydrated. This is actually a myth because people tend to confuse water intake with fluid intake. Water intake is simply drinking water, but fluid intake includes all drinks and foods containing water. When we talk about keeping yourself hydrated, it's about everything you consume, not just plain water. That's why the advice to drink 2 liters of water daily is not exactly correct for everyone. In this video, we will give you tips on monitoring your water intake for the best kidney health, from when to drink water to how much to drink, and the safety levels of different types of water. Note that in some cases, drinking only plain water may not be enough. Next, we will explain in detail how drinking too much or too little water can damage your kidneys. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Drinking too much water. While experts are still determining the proper amount of water needed daily, drinking more than 1 liter or about 1 quart every hour will cause extra stress on the kidneys. According to the Merck Manual, one estimate suggests that repeatedly drinking more than 23 liters or 24 quarts of water over 24 hours may cause excessively high water levels in a young adult with normal body function. Rest assured, your kidneys usually filter out excess water. So, water toxicity, overhydration, water intoxication, or drinking too much water occurs rarely in healthy people. People at risk for overhydration are endurance athletes, premature babies, and people with certain mental illnesses and pituitary disorders. Water intoxication may also occur in those with kidney, liver, and heart disease due to their impaired abilities to maintain proper fluid balance. People taking on drinking challenges and those who have consumed large amounts of alcohol may also be subject to water toxicity. Certain medications such as diuretics, antidepressants, antipsychotics, and drugs such as MDMA or ecstasy may cause people to consume excessive amounts of water as well. Drinking too much water too quickly dilutes the sodium level in the blood. Healthy sodium levels are between 135 and 145 milliequivalents per liter. When sodium levels are under 135 milliequivalents per liter, this is known as hyponatremia. Healthy kidneys can remove excess water at a rate of about 1 liter or 1 quart per hour. Water intoxication occurs when the kidneys can't remove water fast enough to maintain the normal sodium balance. Water will then move into the cells, which contain more sodium, causing fluid retention. The fluid retained in cells causes them to swell or become too big. This state, a main concern of water intoxication, may even cause swelling in brain cells, known as cerebral edema. Symptoms of water intoxication may include trouble thinking clearly, nausea, and vomiting. Early treatment is essential, as severe cases may cause seizures or death. During the 2002 Boston Marathon, almost 500 runners enrolled in a study investigating race-related causes of hyponatremia. After finishing the race, over 60 marathoners experienced low blood sodium levels related to overhydration. To reduce the risks of hyponatremia, the researchers recommended that long-distance runners estimate their water needs during a marathon. They should weigh themselves before and after training runs and hydrate according to how much fluid they've lost through sweating and how thirsty they feel. Another study, published online in 2021 with BMJ Open, surveyed 590 patient reports. The study included patients with hyponatremia resulting from water toxicity. On average, the patients drank 8 liters of fluids daily. Severe effects included seizures and coma, while other symptoms reported were vomiting, lightheadedness, and weakness. Unfortunately, a small number of patients experienced brain damage due to complications, while over 75 of the patients died. Overall, drinking too much water, although not common, may cause low sodium levels in the blood and fluid retention. These problems can cause severe damage to the kidneys. Studies also highlight the dangers associated with overhydration that may lead to death. Next, learn how kidney damage can also occur from drinking too little water. Drinking too little water. To stay hydrated, you should know when you need more water. Under normal circumstances, water loss occurs when we sweat, breathe, defecate, and urinate. For instance, During physical exercise, you breathe faster and sweat more. Pregnant or nursing women have additional water requirements. Also, water needs may increase if you're in hot weather or high altitudes. When you are ill, you may lose significant amounts of water with a fever, vomiting, or diarrhea. Dehydration occurs when water is lost faster than it can be replaced. Due to the abundance of water in most places, people can easily avoid becoming dehydrated. However, many adults, particularly older adults, are chronically dehydrated. Some older individuals have weakness, decreased thirst sensation, diabetes, or kidney damage that may put them at risk. The risk of dehydration also increases if you drink too much water without enough electrolytes. Still, we'll discuss this later. When the body is dehydrated, it attempts to correct the fluid imbalance through several mechanisms. Special sensors in the brain, known as osmolar receptors, detect changes in the blood's fluid and electrolyte balance. The hypothalamus signals the pituitary gland to release antidiuretic hormone, or ADH for short. ADH tells the kidneys to stop releasing fluid into the urine and instead reabsorb it into the blood. The kidneys also have a mechanism to compensate for dehydration. When the blood pressure drops, they release the hormone renin, which activates another system that increases blood pressure. Renin turns another hormone, angiotensin 1, into angiotensin 2. Angiotensin 2 signals the adrenal glands on the top of the kidneys to release aldosterone. Then, aldosterone signals the kidneys to reabsorb more sodium and water. This brings the blood pressure back into balance, while also helping you become hydrated. Dehydration should be addressed to avoid long-term kidney damage, even in mild cases. If dehydration continues and becomes severe, the kidneys will develop acute kidney injury, or AKI for short, which can occur in as little as 2 days. Low fluid volume also increases the risk of urinary tract infections and kidney stones. Even waste products may build up in the filtration system or return to the blood unfiltered. Fortunately, the hypothalamus also signals when you need to drink water. In response to low blood volume, the brain triggers thirst and, interestingly, detects when you swallow fluids. However, by the time you become thirsty, you may already be mildly dehydrated. So it's best to sip water throughout the day and drink more when you are thirsty. Older adults or those with brain injuries may have a reduced ability to sense thirst and should make sure to maintain adequate fluid intake. A large 2021 study published in Clinical and Experimental Nephrology examined the water consumption of over 50,000 Koreans. The results showed that increasing water intake was important for preventing kidney damage, especially in older men. As the participants drank more water in proportion to their body weight, their kidney function improved. In another 2016 study published in the American Journal of Physiology, researchers highlighted dehydration as a serious concern among field workers. This population has increased rates of chronic kidney disease. The study's findings suggested that thousands of field workers' deaths may be related to chronic dehydration. Researchers looked at various types of fluid intake in dehydrated rats to determine the effects on kidney damage prevention. They concluded that the rats who drank soda had the lowest hydration and the worst kidney damage. Rats drinking water or water sweetened with a natural sugar substitute only suffered mild effects of dehydration. So, it's important to stay hydrated by drinking water, not soda. This section discussed water loss and dehydration. Kidney injury, kidney stones, and urinary tract infections may result from inadequate fluid intake. Next, we'll highlight ways to monitor your personal needs for fluid balance. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Monitor your water intake for kidney health. As mentioned, it's essential to pay attention to your thirst. Urine color, odor, and frequency may indicate how well fluid is balanced. Clear urine usually suggests that you are hydrated enough or too hydrated. When you drink more, you urinate more frequently. When you are dehydrated, your urine turns yellow or amber and may have a strong smell. As the urine becomes more concentrated, you'll also make fewer trips to the bathroom. In this case, you should increase your water intake. However, other factors such as infections and kidney disease may also cause changes in urine characteristics. When you are not hydrated, you may wonder if you should have an electrolyte drink. The answer is yes and no. First, let's discuss what electrolytes are, why they are important for healthy body functioning, and situations when the body may experience electrolyte imbalance. Electrolytes are tiny particles that carry an electrical charge. They help the body perform vital functions, including nutrient and waste transport, fluid balance, muscle contraction, and nerve conduction. They also help maintain your acid-base balance, heart rate, and heart rhythm. You've probably already heard the names of the most common electrolytes: sodium, potassium, chloride, calcium, magnesium, phosphate, and bicarbonate. Like water, they leave the body naturally through urine, feces, and sweat. You may lose more electrolytes along with fluid during illness with fevers, vomiting, or diarrhea. Electrolytes can also be lost when you're sweating heavily due to exercise or hot and humid outdoor temperatures, and also when you're taking certain medications. High blood sugar in people with diabetes also causes both electrolyte and fluid loss. Now, when you become dehydrated in these situations, electrolyte replacement drinks are helpful for replenishing fluid and electrolytes quickly. Some people may want to drink them after mild or moderate exercise, but water will usually be sufficient. However, these drinks may still be beneficial after exercising for over an hour with intense sweating or under an hour with vigorous exercise in high temperatures. Electrolyte drinks aren't generally needed throughout the day and may be harmful in some instances. They contain high amounts of sodium, potassium, magnesium, and chloride. For people with kidney or heart conditions, these drinks may increase blood pressure or dangerously raise blood electrolyte levels. Some electrolyte drinks have high amounts of sugar, which can contribute to diabetes, obesity, and other health problems. They may also be full of unhealthy food dyes, preservatives, and artificial sugar substitutes. So, it's best to drink water. If you must drink these electrolyte drinks, read the ingredients label carefully. Most foods also contain electrolytes, but whole food sources from plants are the most nutritious. Good choices would be fruits, such as citrus and coconut water, but also some leafy green vegetables, honey, ginger, brine from fermented foods, beans, seaweed, pumpkin seeds, and fatty fish. These are all excellent examples of nutrient-dense electrolyte food sources. If you've watched the entire video so far, you will be able to recognize common myths about staying hydrated. Myth number 1. You must drink 8 glasses of water daily. Myth number 2. The more water you drink, the better it is for your body. Myth number 3. Drinking water is the only way to stay hydrated. Myth number 4. You should always drink high amounts of electrolytes or sports drinks when exercising. Another myth is that caffeine and alcohol are dehydrating. While both are diuretics that increase urination frequency and volume, moderate consumption can still help maintain your hydration. However, limit caffeine and alcohol along with other sweet drinks, since they can have damaging effects on the kidneys when consumed excessively. Up to 400 milligrams of caffeine a day, or about 4 9-ounce cups of coffee, is considered safe. Some people with kidney disease need to be cautious about the amount of water they drink. As kidney damage worsens, doctors may prescribe a limited fluid intake, particularly for those on kidney dialysis. At this stage, the kidney's capacity to create urine and regulate the amount of fluid in the body is greatly reduced. Some people may even stop making urine. However, people with kidney stones or urinary tract infections, or UTIs, should increase their hydration. Flushing the kidneys with water will help the stones fall apart. Besides that, drinking water will also help fight UTIs. This is because flushing the kidneys and bladder helps remove unwanted bacteria. You may be wondering if bottled water is better than tap water and what type of water you should drink for kidney health. There are a few factors to keep in mind. Tap water standards around the world vary in their safety. Tap water's purity depends on the location where you get your water. Not all drinking water at public facilities is safe. Some tap water may have high levels of manufactured chemicals or even natural minerals that are linked with health conditions such as cancer. In places where water sanitation is poor, people drink more bottled water. However, in places where tap water quality meets safety standards, marketing efforts may create the belief that bottled water is a better alternative. However, bottled water quality can also vary greatly, depending on its source, the material of the bottle, how the water is stored, and the substances in the water itself. In the United States, bottled water safety standards are similar to those of tap water, but this may not be true worldwide. No matter which type of water you decide to drink, drinking from a safe source is highly important. Sugary beverages may seem like a good choice when you are thirsty. However, they aren't hydrating and might even cause more harm than good. Drinks containing high amounts of sugar include sodas, smoothies, coffee, energy, and fruit drinks. Not only do they cause an unhealthy increase in blood sugar levels, but they can also increase dehydration. Beverages high in sugar trigger ADH release, which causes the kidneys to retain fluid and concentrate the urine. This puts extra stress on the kidneys to filter blood. Also, sugar from sweetened drinks can increase the production of uric acid and other byproducts. These waste products can cause inflammation and the creation of harmful substances called free radicals. Free radicals may cause damage within the tiny filtration structures of the kidneys. Sodas are also linked with causing kidney stones. Drinking large amounts of caffeine in coffee, tea, and energy drinks can cause high blood pressure, which puts additional strain on the kidneys. As an alternative, try sparkling water, black coffee, green tea, and low-sugar smoothies. Overall, drinking water is usually the best way to stay hydrated. A 2021 narrative review published in the European Journal of Nutrition states that water, without other additives, is the healthiest beverage. Next, we'll discuss tips that will help you decide when to drink water. Tip number 1. To make sure you are getting enough water throughout the day, drink water before and during meals and when you become thirsty. Tip number 2. Make sure to hydrate when you increase your physical activity. Tip number 3. Note that drinking large amounts of water infrequently will only temporarily hydrate you. This amount of water may leave the body quickly to prevent blood dilution and low sodium. Instead, do the opposite. Drink small amounts of water frequently and eat hydrating foods throughout the day. Having some water in the evening will help keep you hydrated overnight. It can also decrease your body temperature to help you sleep better. However, if you have acid reflux, you might want to stop drinking water for at least 2 to 3 hours before you go to bed. Alternatively, drink only small amounts of water at bedtime to minimize the need to urinate at night. In this section, we discussed learning to recognize your signs of hydration through thirst and urine indicators, bottled water and tap water safety, and some common myths. Next, we will summarize the critical points made in the video. Be sure to watch until the end to reinforce and help you remember each point. Avoid these 7 drinks that can destroy your kidneys fast. What if I told you that your seemingly harmless daily drink could be a ticking time bomb for your kidneys? Do you know that about 1 in 3 adults in the US are at risk of kidney disease? With such an alarming statistic, it's crucial to note that every day, more than half of Americans unknowingly consume beverages that can destroy their kidneys, which increases the risk of premature death by 5 to 10 times. So, what beverages should you avoid? What do wise drinkers know that you don't? Stay with us. In just a matter of minutes, we'll reveal the top 7 drinks you need to cut down or take out from your diet to protect your kidneys. Brace yourselves for some shocking revelations. And don't miss out on our suggested tasty and healthy alternatives for these drinks in the final part of this video. 7. Fruit punch. Fruit punch and concentrated fruit juice from stores are often hailed as a healthy choice, especially for kids. However, if you read the label, you can see that these drinks contain little real fruit juice and are full of added sugars. Sugars are proven to increase the risk of high blood pressure, obesity, and diabetes. These conditions are a major risk factor for kidney problems. Around 30% of people with type 1 diabetes and 10 to 40% of those with type 2 diabetes will experience kidney failure in the long run. The Center for Disease Control, or CDC in short, in line with the 2020 to 2025 US guidelines, recommends consuming less than 10% of your daily calories from added sugar. For instance, if you consume 2,000 calories daily, because there are 4 calories in 1 gram of sugar, the limit would be 200 calories from added sugar, or about 50 grams. Otherwise, the American Heart Association, or AHA in short, suggests keeping added sugars to less than 6% of your daily calories. That means about 24 and 36 grams for women and men, respectively. When it comes to fruit punch, a single 12-ounce serving can give you 40 grams of sugar. That's 160 non-nutritional calories. This is about 80% of the CDC's daily sugar limit and almost twice the AHA's recommendation. Such high sugar is quickly transported to your bloodstream and can quickly spike your blood sugar levels, adding extra strain on your kidneys as they filter it out. So, drinking less store-bought fruit punch or skipping it altogether is a wise choice for your kidneys and overall health. Another concern is that these juices, like many store-bought drinks, may contain phosphorus additives and acidic preservatives, which can cause kidney stones. We'll delve into this further in the following sections. After all, read the label to be cautious and avoid the unhealthy pitfalls of fruit punch. It's better for your kidneys if you make your own juice at home. Plus, choose whole fruit or 100% fruit juice when possible. 6. Sodas. When considering what drinks to avoid for kidney health, sodas should be your number one concern. Soda is mostly water, with almost no nutritional value, yet many harmful ingredients. Scientific studies have extensively documented the link between sodas and kidney disease. First, sodas contain copious amounts of sugar. A 16-ounce soda hides 155 calories and 40 to 50 grams of sugar inside, hitting the CDC's daily sugar limit and doubling the AHA's recommendation. So, try to avoid this sugary disaster for your kidneys and overall health. Drinking sugary sodas can increase your risk of kidney stones, the solid deposits that can cause severe pain and disrupt kidney function. In a study with more than 194,000 participants over 8 years, scientists found 4,462 new cases of kidney stones. People who drank the most sugar-sweetened cola had a 23% higher risk of developing kidney stones compared to those who consumed the least. Moreover, sodas, especially the dark-colored varieties, contain phosphorus from preservatives and additives, like polyphosphates. Phosphorus can be harmful if you have kidney disease. In a study of chronic kidney disease patients not on dialysis, researchers measured kidney function and phosphate levels in 1,716 patients over 3 years. Phosphate is a form of phosphorus. They discovered that patients with high phosphate levels were twice as likely to start dialysis or die compared to those with lower levels. Note that when you consume natural organic phosphorus from foods like fruits and vegetables, your gut only absorbs about 40 to 60% of the mineral. However, sodas with added inorganic phosphorus are absorbed much more efficiently, at a level of over 80%. With such a high absorption rate of phosphorus and a high amount of added sugar, soda is toxic to the kidneys. So, it's advised to cut down on soda as much as possible. However, in reality, most Americans' consumption habits go against this advice. Because soda seems to quench thirst quickly, many people consume large amounts at once for rehydration. The fact is that soda fails to provide proper hydration and can even dehydrate you due to its sugar and caffeine content. Repeated dehydration can damage your kidneys over time. If you want to check if you are dehydrated, here are some tips. Good hydration manifests by light yellow or clear urine, soft lips and skin, and not feeling thirsty. You may be dehydrated if you have cracked lips, dry eyes, a dry mouth, or scaly skin. Nothing beats water for optimal hydration. If you want something fizzy, go for a seltzer or sparkling water instead of soda. Kombucha is another healthy fizzy drink. It's fermented tea in which sugar is turned into healthy organic acids. 5. Energy drinks. Alongside sodas, energy drinks are among the worst options available at any store. They're designed to give you a quick energy boost with legal stimulants and are marketed as drinks to improve mental focus and physical performance. Energy drinks may also boast about added amino acids, vitamins, and other ingredients, suggesting they're better than others. However, all these claims aren't regulated by the FDA, and most lack scientific evidence. No matter what the ads tell you, no energy drink is truly healthy. They are full of sodium, sugar, artificial sweeteners, or caffeine, and all are not good for your kidneys. Although it's rare, energy drinks can sometimes cause acute kidney problems. In 2014, a 40-year-old man experienced acute kidney failure after consuming large amounts of Red Bull daily for 2-3 weeks. His kidneys recovered within 2 days of stopping Red Bull and remained healthy for 10 months. Now, let's see what makes energy drinks unhealthy for your kidneys. Energy drinks typically have 54 to 62 grams of sugar in a 16-ounce serving, which exceeds the recommended daily amount for an entire day. As we talked earlier, sugar or artificial sweeteners can put more strain on your kidneys. What's more, energy drinks have a high sodium content. Depending on the brand, an 8-ounce serving can contain up to 350 milligrams of sodium, covering 15% of the recommended daily intake. Sodium is a mineral required by the body in small amounts. The recommended daily sodium intake in the US is 2,300 milligrams as the upper limit and 1,500 milligrams as the ideal amount. These recommendations focus on blood pressure and bone health rather than kidney stones. However, sticking to the ideal sodium intake can help lower urine calcium levels while benefiting blood pressure. Eating too much sodium can raise your risk of kidney stones. Also, excessive sodium intake can raise blood pressure, which can damage and weaken the kidney's blood vessels by constricting and narrowing them. Damaged kidney blood vessels may impair kidney function, leading to difficulty in removing waste and excess fluid from your body. This can further raise blood pressure, creating a dangerous cycle and potentially causing kidney failure. The amount of caffeine in energy drinks is enough to dehydrate you and make you feel tired and sluggish. Also, dehydration makes the kidneys work harder to balance water and electrolytes, possibly causing kidney damage. Energy drinks often contain 80 to 150 milligrams of caffeine in an 8-ounce serving, which is equal to 5 ounces of coffee or 2 12-ounce sodas. But watch out for larger sizes. Some come in 20 to 24-ounce cans with over 500 milligrams of caffeine. That's like having 14 cans of soda. This is enough caffeine to be dangerous, as the recommended amount is no more than 300-400 milligrams per day. So, next time you buy energy drinks, it's essential to read their labels. Let's check for an ingredient named guarana, a plant extract rich in caffeine. About 1 gram of guarana equals roughly 40 milligrams of caffeine. So, if an energy drink contains guarana, it means there's more caffeine in it. So, what are safer choices for your kidneys than energy drinks when you need a pick-me-up? You can choose herbal teas which have lower caffeine content, such as peppermint tea, ginkgo biloba tea, ginger tea, ginseng tea, or yerba mate. And don't forget to drink enough water to protect kidney function while enjoying these caffeine-containing drinks. Keep in mind that energy drinks aren't a good way to get your vitamins and minerals. You can get these nutrients quickly and naturally from fruits and vegetables. Instead of relying on energy drinks, try making smoothies with these natural sources for a healthier option. Or just eat the whole fruit. A good snack can be more than energizing. If you're enjoying our video so far, please give us some hints by dropping a like, and we'll make more content like this. 4. Diet sodas. Now, we feel the need to distinguish diet sodas from regular sodas because many people don't know the harmful effects of the supposedly healthy diet sodas, so they unknowingly consume diet sodas and destroy their health. As a reason, diet sodas contain no sugar or calories, but still provide a familiar taste. With these characteristics, it's no surprise that diet sodas and other low-calorie sweetener drinks have become a hit for quenching thirst or losing weight. However, there's no solid evidence to support the idea that they aid in weight loss, and some individuals actually end up gaining weight due to artificial sweeteners. Therefore, diet sodas have no special benefits. In fact, Diet sodas may pose kidney risks similar to or even greater than regular sodas. A study published in Epidemiology involved 467 healthy people and 465 people with newly diagnosed chronic kidney disease. It found that consuming 2 or more colas daily doubled the risk of chronic kidney disease. This risk was the same for regular and diet colas. The issue with diet sodas stems from their use of artificial sweeteners to replicate the taste of table sugar. Common artificial sweeteners in diet sodas include aspartame, saccharin, sucralose, and ACE-K. These sweeteners have been tied to a higher risk of kidney function decline. Additionally, large-scale studies found that having more than one serving of diet sodas every day could increase the risk of high blood pressure by 14%, diabetes by 38 to 68%, heart attack and stroke by 30 to 43%, and death by 30%. So, steer clear of diet sodas for the sake of both your kidneys and overall health. But it's not just about sweeteners. Diet sodas, like regular sodas, contain phosphorus. This phosphorus, in the form of phosphoric acid, gives sodas their unique tangy flavor. However, too much phosphorus can make your kidneys more acidic, raising the risk of kidney stones and diseases. Now, are you looking for a healthier swap for diet soda? Sparkling water would be the best choice. For a refreshing flavor, add a splash of lemon juice. You can also mix real fruit juice with sparkling water to make your own tasty and nutritious soda. When you're craving something sweet, consider using healthier sweeteners like stevia and erythritol. They're natural options that won't raise your blood sugar or strain your kidneys. They also contain antioxidants that can help protect your cells from damage. 3. Sweetened tea and coffee. Iced tea and coffee are popular beverages, particularly in summer. However, several aspects of these beverages can affect your health, especially kidney health. Commercially prepared iced teas often contain high levels of added sugars and calories. One 12-ounce serving often contains about 28 grams of sugar, almost as bad as soda or fruit juice. Excessive sugar intake can lead to obesity and worsen diabetes, a major contributor to kidney disease. More concerning, flavored coffee drinks like frappuccinos or cappuccinos may contain unhealthy fats from toppings like whipped cream. The kidneys depend on adequate hydration to effectively filter waste and maintain electrolyte balance. However, tea and coffee are well-known diuretics due to their caffeine content, which can dehydrate you. Prolonged dehydration puts a strain on your kidneys, causing kidney damage over time. So it's essential to check labels to monitor your caffeine intake. The FDA has set a daily limit of 400 milligrams for adults. For pregnant or nursing people and children under 2 years old, it's advised to avoid caffeinated beverages. When you consume 200 milligrams or more of caffeine, you might experience symptoms like headache, anxiety, trouble sleeping, diarrhea, stomach upset, twitching muscles, and feeling restless. Also, caffeine can increase blood pressure, possibly damaging the blood vessels inside your kidneys. Consuming very high doses of caffeine, exceeding 10 milligrams per kilogram of your body weight a day, can lead to severe health problems. For a person weighing 50 kilograms or 110 pounds, a very high dose is around 500 milligrams of caffeine per day. This level of intake has been linked with chest pain, irregular heartbeat, and stroke. Toxic effects like seizures can occur at around 1,200 milligrams of caffeine, which equals 12 to 16 cups of coffee. Be cautious with concentrated liquid caffeine supplements. Half a cup can contain over 2,000 milligrams of caffeine, well above a toxic dose. When buying coffee and tea, check the labels to select a suitable caffeine amount. Also, note that even decaf coffee has a small amount of caffeine. Now, if you're thinking of quitting sweetened tea or coffee, keep in mind that abruptly stopping caffeine isn't recommended. It can lead to caffeine withdrawal headaches, especially if you've been consuming it daily. Instead, try slowly reducing your intake or switching to brewing your own unsweetened tea or black coffee for a gentle caffeine boost. These options may also offer antioxidants and beneficial nutrients. 2. Alcohol. Experts define one drink as a 12-ounce bottle of beer, a 5-ounce glass of wine, or a 1.5-ounce shot of hard liquor. Drinking more than 3 drinks a day, or more than 7 per week for women, and more than 4 drinks a day, or more than 14 per week for men, is considered heavy drinking. No matter the alcohol type, heavy drinking can double the risk of kidney disease. Alcohol can mess with your body's water balance, leading to increased urine production and subsequent dehydration. Dehydration, as we talked about earlier, can really cause kidney damage in the long run. Moreover, alcohol can also indirectly harm the kidneys. Having more than 2 drinks a day increases the risk of high blood pressure, a major risk factor for kidney diseases. Also, drinking heavily can harm your liver, potentially leading to kidney damage. Exercise caution if you develop alcoholic cirrhosis, which involves scarring of the liver tissue, or alcoholic hepatitis, characterized by inflammation of the liver. In these conditions, the body changes can be severe enough to temporarily stop kidney function or cause complete kidney failure. What's even more worrying is the kidney-damaging effect of binge drinking, or consuming more than 4 to 5 drinks within 2 hours. Binge drinking can dangerously elevate your blood alcohol levels. This sudden rise can lead to a drop in kidney function called acute kidney injury, which may require dialysis. While acute kidney injury often improves over time, it can sometimes cause lasting damage. Some people should avoid alcohol altogether, so talk to your doctor if you have questions about whether alcohol is safe for you. If it is, remember to drink in moderation. Generally, men should limit alcohol to 1 to 2 drinks per day, while women and those over the age of 65 should stick to just 1 drink per day. To protect your kidneys, eat when drinking alcohol and watch portion sizes, especially with wine and beer, because glasses often exceed standard serving volumes. Light beer or dry wine is better than sugary and high-calorie drinks like liqueurs or creamy cocktails. What about non-alcoholic beers? Companies often add up to 0.5% alcohol to mimic the taste of alcohol. Even though it's a small amount, it can still lead to dehydration. If you drink non-alcoholic beers, remember to drink a glass of water after each one to keep your kidneys hydrated. 1. Low-fat yogurt drinks. It's important to be wary. Yogurt can be highly nutritious, but not all types are alike. Low-fat yogurts often have added sugar or molasses to compensate for reduced flavor satisfaction from fat. This compensation can make them taste better, but it is not good for your kidneys. For instance, a cup, 245 grams, of low-fat yogurt can have more than 45 grams of sugar, equal to about 11 teaspoons. That's more sugar than what the AHA recommends for both men and women each day. And it's almost at the CDC's daily sugar limit, all in just 1 cup. Excessive sugar intake can decrease calcium reabsorption by kidney cells, causing urine calcium levels to rise. This can decrease the urine volumes and create conditions favoring kidney stone formation. Moreover, low-fat yogurt may not offer the same health advantages as full-fat yogurt. The fat removal process can result in the loss of vital nutrients, such as vitamins and calcium. So, when you pick yogurt, it's best to choose full-fat options with minimal added sugar. If you come across any form of sugar, such as corn syrup or evaporated cane juice, it's best to skip those yogurt options. You can also select plain yogurt and add your own fruit to control sugar intake and boost nutritional value. Preparing fermented foods or drinks, such as yogurt, kefir, or kombucha at home, is the best choice. These homemade versions are healthier than store-bought ones, which typically contain added sugar and preservatives. Additionally, store-bought kefir and kombucha tend to have lower probiotic levels. Plus, homemade fermented drinks are budget-friendly because you can simply use your own new carton of milk or tea to start a new batch.
Misinformation alert. We fact-checked this viral kidney story seen by millions. 2 months ago, a story went viral on YouTube about a woman who had kidney damage from taking a common vitamin for 2 months. Over 70 YouTube videos cover this story, and many of them look similar. Together, they've been seen by millions of viewers. And this is worrying because after watching almost all of these videos and thoroughly researching the topic, we discovered that not only do they contain several pieces of misinformation, but they also give false claims and misleading advice about kidney health. Many people, especially those without a background in science, may fall for these claims and end up making bad and sometimes dangerous choices for their health, specifically their kidneys. So, without further ado, let's get into details. Those videos say the woman's kidneys failed from taking too much vitamin C. They even conclude that vitamin C can destroy your kidneys. But one cannot simply make such a bold claim based on just one case study. And the bigger problem is, the case study that they refer to doesn't even exist in real life. We've spent weeks going through all the material we could find about this story and have verified everything along the way. So we'll go over the results of our research in this video to help you see vitamins and kidney health in a clearer light. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. A suspicious story. Let's start with the story they shared. According to various health channels on YouTube, here's what they say happened. In December 2012, a 55-year-old woman with kidney disease was brought to the emergency department. She was extremely weak and had swelling, a very slow heart rate, and a body temperature of 93 degrees Fahrenheit, which is equivalent to 33.9 degrees Celsius. Her kidney function was rapidly failing with high serum creatinine levels of 3,530 milligrams per deciliter, a number much higher than she'd had 2 months before. She had stopped producing urine, and her body was overwhelmed with toxins, so she needed immediate dialysis in the intensive care unit. And surprisingly, the medical team discovered that a vitamin C supplement was the cause. This case seems to highlight the potential dangers of vitamin C, right? Well, maybe. We searched for the actual facts in this case since none of the videos provide source references. At first, we couldn't find any reliable news reports that aligned with the details they describe. But after delving deeper, we found a very similar case, which was actually reported in the journal Curious in 2022, not 2012. This article is the only trustworthy source we found regarding a 55-year-old woman with acute kidney injury that was thought to result from vitamin C toxicity. Some of the other details match closely, so it's highly likely this case is the one these videos are talking about. So now we'll review some more of the incorrect information. First, let's look at the serum creatinine level, a key marker for kidney function. Normal levels for women are about 0.6 to 1.1 milligrams per deciliter, and higher levels often mean your kidneys are having trouble. When the woman in this case got to the emergency department, her creatinine level was actually 35.3 milligrams per deciliter, which is extremely high and indicated that her kidneys were failing. Things got interesting when we saw the many YouTube videos claiming her serum creatinine level was 3,530 milligrams per deciliter, which is 100 times higher than the number reported in the case study. For comparison, the highest serum creatinine level recorded so far is 73.8 milligrams per deciliter, much lower than the number those videos claim she had. So even if the case study we found was not the same one, they are making an impossible and wildly inaccurate claim. The timing is another suspicious detail. They claim her creatinine level was much higher than it was 2 months before. However, we couldn't find that information from the original report of this case, our only reliable source. There is no information about how long she had taken the vitamin C or what her serum creatinine level had been 2 months prior. The report does mention that 4 months before this incident, her creatinine was 2 milligrams per deciliter, while the range of normal is 0.6 to 1.1 milligrams per deciliter. This confirms that she did have chronic kidney disease, or CKD. Given the similarity of the facts reported in the published case in Curious, We feel there is enough evidence to refute some of the inaccurate statements made in these videos, which are clearly lacking in credibility at certain points. We decided to try our best to provide information that will keep people from following the faulty claims and advice they contain. Wrongful claim number 1, vitamin C can destroy your kidneys. This is the most significant claim in these videos and should be addressed first. Some of their other advice regarding different vitamins could also be harmful if followed, so stay tuned to learn what to be cautious about. Regarding the woman's AKI in these videos, they assert that the central focus of her health debacle was none other than vitamin C. This implies that vitamin C was solely responsible for her kidney issues. However, remember when they reported her serum creatinine level as 3,530 milligrams per deciliter? As we previously pointed out, that's simply not possible. No one can have a creatinine level that high, regardless of vitamin C intake. It's also crucial to note that these videos completely overlook key aspects of the patient's medical history that could have contributed to her AKI. If the data is not accurate and not exhaustive, the conclusions drawn from it are questionable. Still, the question is left for us to answer. Did vitamin C actually cause AKI? Let's take a close look at the real case reported in Curious, the only reliable source that has the patient's medical history. We'll provide a clear analysis of how vitamin C actually impacts kidney health, both in this particular case and in general. Because, again, you cannot simply draw a conclusion based solely on one case study. In the Curious case, the doctors also presumed that taking too much vitamin C caused the woman's AKI. But they also stressed something important: the dosage. And that's true. Let's acknowledge that taking vitamin C is generally perceived as safe. However, excessive intake can cause acute kidney damage in individual cases, especially in people with pre-existing kidney disease. Here's how. Once vitamin C enters your body, it is broken down into oxalate. Oxalate is a major component of calcium oxalate crystals, the most common type of kidney stones. Patients with kidney disease have trouble filtering and excreting calcium oxalate from the body, which increases the risk of oxalate crystals forming and building up in certain organs. These crystals can deposit in the kidney tubules, leading to obstruction, inflammation, tissue damage, scarring, and eventually shrinking of the tubules. In other words, if you take vitamin C in excess, this can increase the risk of AKI from crystal deposition and kidney stones. This is especially the case for people who already have kidney disease. Now, turning to the case of the 55-year-old woman, the doctors presumed her AKI was from excessive vitamin C because her lab tests for other causes were negative, and her kidney ultrasound showed a large number of small kidney stones. Additionally, a kidney biopsy revealed oxalate crystals, causing scarring of the tissue. When they looked at her medication history, it appeared she had been taking at least 1,000 milligrams of vitamin C daily from a supplement, and an unknown amount from a daily multivitamin. However, her complicated history and other medical conditions made it hard for doctors to determine her exact intake before she was hospitalized. But to give you an idea, the recommended daily amount for vitamin C is just 75 to 90 milligrams for adults. So, taking over 1,000 milligrams is like having 10 times more than needed. At this point, it's reasonable to conclude that her excessive vitamin C intake did contribute to her AKI. However, in our assessment, there isn't sufficient evidence to assert that vitamin C was the sole cause in this particular case, much less as a general conclusion. There is much more to this case than the patient's vitamin C intake. Her medical history, dietary habits, and supplements and medications intake must also be considered before making any conclusion. Let's have a quick look at these factors. Medical history. The patient already had chronic kidney disease, as seen by her high creatinine level 4 months prior. In addition, she had a history of hypothyroidism, but was not taking her thyroid medication as prescribed. On her arrival in the ED, she was thought to have a severe hypothyroid condition known as myxedema coma, which had caused her to become confused and pass out. Myxedema coma can also lead to significant metabolic abnormalities, resulting in metabolic acidosis, which means the blood becomes too acidic. This can hinder a process that normally prevents oxalate buildup. Even though her acidity wasn't severe when she was admitted, her acidosis probably created a favorable condition for oxalate buildup and kidney injury. Other factors. Oxalate buildup, which can cause AKI, can also result from lifestyle choices like not drinking enough water or consuming triggering foods. If she had been eating a lot of high oxalate foods like nuts, chia seeds, and green smoothies, her risk for oxalate crystal deposition might have been increased. A diet rich in sugar, salt, and animal proteins can also increase this risk. Turning back to the original report in Curious, it didn't mention her dietary factors, and her initial blood oxalate levels had not been measured, so it's just a possibility to think about. Considering her health background, it's important to review the medications she was taking before being hospitalized. According to the published case, these included vitamin C, 1,000 milligrams daily, calcium, 500 milligrams, digestive enzymes, docusate 100 milligrams, cranberry 500 milligrams, a multivitamin, ingredients not specified, omeprazole 20 milligrams, Miralax 17 grams daily, vitamin D 5,000 units daily, and Synthroid, a brand of thyroid hormone. Besides the vitamin C, it's uncertain if any of the other supplements are related to her AKI. However, her high vitamin D intake should be considered. According to the U.S. Office of Dietary Supplements, or ODS, and the UK National Health Service, or NHS, in adults, the recommended prophylactic upper intake level for vitamin D is 4,000 IU per day. Adults with vitamin D deficiency should be treated with 6,000 IU per day for up to 3 months. Patients with chronic kidney deficiency are prone to developing vitamin D deficiency. In the discussed case, it is mentioned that the patient took 5,000 IU of vitamin D every day. However, her history of diagnosed vitamin deficiency, or the duration of the treatment, was not discussed. Excessive vitamin D intake may increase calcium levels in the blood, and consequently, they may deposit in the kidney as stones. Although vitamin D toxicity is rare, it's recommended to be cautious with high doses. Just like vitamin D, cranberry juice has also been linked to a higher risk of oxalate stone formation. Also, cranberry supplements, like the 500 milligrams daily dose this patient took, can increase urine oxalate levels. However, the U.S. Pharmacopeal Convention, USP, an organization that sets standards for dietary supplements, decided that there isn't enough evidence to require warning labels on cranberry supplements for kidney stones. Cranberry juice and supplements are widely used to prevent or treat urinary tract infections, so be mindful of the risk. To sum this up, this patient's AKI could have been primarily due to excessive vitamin C intake, but other factors such as dietary habits, chronic diseases, and medications prescribed for these conditions, and complications of untreated hypothyroidism also might have contributed. We can't point the finger at vitamin C from just this particular story. The most important takeaway is that one case study alone isn't enough to guide your health decisions, such as making major changes to your diet or changing doses of any supplement. It's always important to consult with your healthcare provider before making such changes. Cases like this one are uncommon and should be understood in context. Now, we'll go over some more sketchy advice given in those YouTube videos. Stay tuned. Right after that, we'll share tips on fact-checking so you can detect misinformation online. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Wrongful claim number 2, the recommended intake of vitamin C. Many of the videos claim that the daily intake of 1,000 milligrams of vitamin C is commonly recommended to boost immunity and fight vitamin deficiencies. But the truth is quite different. The NHS recommends just 40 milligrams of vitamin C daily for adults. They consider up to 1,000 milligrams safe, but that is the upper limit, not the recommended dose. The ODS recommends 75 milligrams for women and 90 milligrams for men, with a safe upper limit of 2,000 milligrams. So, taking 1,000 milligrams of vitamin C a day is closer to the upper limit and far from the recommended daily dose, although still within the safe range. Some patients take high doses of vitamin C, hoping to cure diseases without first checking with their doctors. However, the benefits of large doses are unproven, and studies have shown an increase in stone formation with doses of more than 1,000 milligrams per day. The Canadian Urological Association advises keeping vitamin C intake under 1,000 milligrams per day to avoid kidney stones from excess oxalates. But American and European guidelines for stone disease don't specify these limits. Note that our bodies are pretty good at keeping things in balance. Even if you take a 1,000 milligrams vitamin C supplement, it doesn't mean all of it remains in your body. It goes through your digestive system first, then it is absorbed and enters the bloodstream, where it is transported to your tissues. When you take 100 milligrams or more daily, your cells get saturated with vitamin C. Taking more than 200 milligrams at once will just slightly increase the levels of vitamin C in your blood, and the excess will be excreted in the urine. That's why increasing doses will not give more beneficial effects as expected, especially when you can get enough vitamin C from foods, for example, half a cup of red pepper, strawberries, Brussels sprouts, or broccoli, or a medium orange or kiwi fruit already gives you 50 to 100 milligrams of this vitamin. Now, all of this gets more complicated for people with kidney disease. Vitamin C deficiency is common in the later stages of CKD, especially in patients with kidney failure on dialysis. Dialysis takes over the kidney's function of filtering waste, and each session can remove several hundred milligrams of vitamin C, which is a lot. Moreover, people on peritoneal dialysis might feel full from the dialysis fluid in their belly and might not eat enough. Also, people with CKD need to limit potassium in their diets, but many potassium-rich foods are also high in vitamin C. In fact, plasma vitamin C levels in patients on dialysis are often below 10 micromolar, a level that can cause scurvy. Some even have levels below 2 micromolar, whereas the normal range is between 30 and 60 micromolar. That's why patients on dialysis often need vitamin C supplements with personalized doses. Wrongful claim number 3, the recommended intake for vitamin D and K2. Those videos also point out 4 other vitamins that might harm your kidneys: B12, E, A, and D. This is technically true. People with kidney disease do need to avoid taking large doses of these vitamins. However, some of the advice on the form and dosage you should take seems questionable. In the scope of this video, we won't go into as much detail as we did with vitamin C, but we'll make sure you have the important information by quickly fact-checking those recommendations. First, regarding vitamin D, some of the videos recommend taking no more than 2,000 IU, or 50 micrograms, daily, along with 100 milligrams of vitamin K2 and magnesium to prevent arterial calcification. We're not sure where they got those numbers from, but let's see what the authoritative sources have to say. The NHS recommends 400 IU of supplemental vitamin D a day for most people and sets the upper limit at 4,000 IU a day for adults. The ODS agrees with this upper limit, but recommends 600 IU for adults under 70 and 800 IU for those over 70. So those videos suggesting 2,000 IU of vitamin D a day might be recommended for some people, but it's important to discuss this with your doctor. Now, the videos do make a good point about combining vitamin D with K2. Simply put, vitamin D helps your body absorb more calcium to strengthen bones, prevent muscle cramps, and avoid osteoporosis. However, too much calcium can build up in your blood vessels and increase the risk of heart disease. Vitamin K2 helps keep calcium in your bones and joints where it's needed and out of arteries, reducing the risk of vascular damage. Fair enough. But suggesting 100 milligrams of vitamin K2 daily is way too much. According to the NHS, adults need about 1 microgram of vitamin K for each kilogram of body weight. So if you weigh 50 kilograms, you'd need around 50 micrograms daily. The ODS also recommends a daily dose of 90 micrograms for women and 120 micrograms for men. Note that a milligram is 1,000 times more than a microgram. So, the 100 milligrams of vitamin K2 the videos suggest is 1,000 to 2,000 times more than recommended. Wrongful claim number 4. The forms of vitamin E. Let's talk about another questionable claim. Some videos state that alpha tocopherol is the synthetic form of vitamin E. This is partly true because both natural and synthetic vitamin E can be alpha tocopherol. Naturally sourced vitamin E is often labeled as D-alpha tocopherol, while the synthetic form is DL-alpha tocopherol. The DL indicates it contains both the helpful natural D form and a less effective synthetic L form. You need to take larger amounts of DL-alpha tocopherol to get the same amount of beneficial vitamin E that you would receive with the natural version. But note that the term alpha in vitamin E does not indicate whether it's synthetic or natural. Alpha simply indicates a type of tocopherol, which is the only form of the vitamin meeting human requirements. Natural vitamin E exists in 8 forms: alpha, beta, gamma, and delta tocopherol, and alpha, beta, gamma, and delta tocotrienol. Some studies suggest that a few of these other forms have potent antioxidant properties that might be more helpful than alpha tocopherol in fighting chronic diseases. This is an ongoing field of research, and scientists haven't reached any conclusions yet. Their confusion about the form of vitamin E reminds us to learn more before buying vitamins. Now, we'll share some tips for choosing the right supplements. Tips for selecting vitamins. First, your body benefits most from vitamins found in natural food sources. If you don't have any known deficiencies, before turning to supplements, try consuming the foods known to be high in the vitamin you are searching for. However, in cases like later-stage CKD, patients may need vitamin C and D supplements because dietary sources might not be sufficient. Second, consult with a qualified health professional before selecting vitamins, as your individual needs can differ based on your health conditions and genetics. It might also be worth getting tested to see if you are deficient in any vitamin. Third, when you start taking vitamins, do your own research to find the right ones in the correct forms. Multivitamins aren't one-size-fits-all, so try to know your specific needs and make sure you aren't getting doses that are too high when combining them with individual supplements. Also, determining the correct doses and timing is crucial, since your body might not use up all the vitamins you take within 24 hours. That's why taking certain vitamins every day or increasing the dose might just be wasting money. Also, the fat-soluble vitamins can build up in your body, creating levels that are too high. It's best to have your doctor or dietitian help you determine when supplements are needed and the right dose for you. Fourth, try to check the ingredients list when shopping. Some cheap vitamins may contain too many harmful additives like fillers, often sugar, bulking agents, modifiers, or coatings that could harm your kidneys in the long run. Spend a few minutes Googling them. Fifth, consider the brand. The Food and Drug Administration, FDA, does not regulate supplements for what they contain nor approve them for any health claims. But you can try to find vitamins from a trusted, FDA-approved lab. You can also look for vitamin supplements certified by the National Sanitation Foundation or the website consumerlab.com. While finding companies that produce natural, non-GMO organic supplements may take time, it's a worthwhile investment in your health. A balanced diet provides all the vitamins you need. Taking too many supplements without consulting your doctor can lead to kidney problems and other issues. Tips for fact-checking claims. The internet is packed with all sorts of health advice and information. While it is a good thing because it gives us free access to valuable information, we need to ensure we are not following incorrect advice. Take your time to research extensively and make sure the information you find is reliable. That means it includes all the data, doesn't miss important details, and doesn't exaggerate the information. One of the most important tips is to avoid jumping to conclusions from any single case study. Everyone reacts differently to medications and vitamins. The case of a woman with AKI from too much vitamin C is an example. Her kidney injury does not mean you should avoid supplemental vitamin C. Just take it, if needed, according to guidelines from authoritative sources. Also, don't forget to talk to your healthcare provider about your treatment options, including the right dose, how long to take it, and any alternatives. So, the next time you hear some news that sounds unusual or dramatic, be skeptical. It's a good idea to double-check with trusted government sites, such as those ending in .gov, like the NIH, and with major universities, such as those ending in .edu and original studies. Also, always look out for conflicts of interest. They can reveal many mind-blowing facts. For instance, a study criticizing vitamins might be funded by a large pharmaceutical company that produces a drug for treating a particular condition, and research claiming diet soda has no harmful health effects could be sponsored by a soda company. Summary. In this video, we've highlighted how risky it can be to base medical decisions on an online video, particularly one focused on a single case study. Those approximately 70 videos that featured the case of the woman overdosing on vitamin C and experiencing acute kidney injury might have unintentionally demonized this essential vitamin. Their conclusions could confuse people and complicate their ability to make health choices. When it comes to vitamins, the dose and type you choose really matters. This applies to all vitamins, not just vitamin C. And here is a crucial note for patients with kidney disease. Your kidneys struggle to process many substances, so always consult your kidney specialist and dietitian before taking any supplements. We hope this video is useful to you at some point. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Stay informed, stay healthy.